there's this like, the only thing we can come to, Michelle, is that you were vaccinated, the vaccine disrupted your autonomic nervous system. We don't know exactly what is not working properly, and because it's disrupted, you have all of these symptoms. And then they'll drill into the back of your head. So they'll do like an MRI, so they'll check. So there's like it's called vein of Galen. So that's like the anatomy that runs like really, really close to the pineal gland. So they need to make sure that they can identify where that vein is, because that is like essential for the vascular flow to your brain. How much, we were going to come up with a financial plan. I needed to digest this information, figure out if that was what I was going to do, you know, come home, talk to my family. People need to know that you're ignored in Canada. People need to know they push this vaccine on everybody, and now you have sick people. So you are super willing to protect the public and promote safety and health. But where are you now? You know,
your tenacity, like you've got a very strong, you know, like, and it's to be commended.
Pineal gland. So it depends. Some say pineal, some say pineal.
Okay.
Yeah. So it is interchangeable, like
pineal
or pineal. Yeah, probably.
Because I was going to pronounce it pineal.
I would say pineal.
Pineal gland,
Pineal
cyst.
Gland. Yeah.
Okay.
Canadian version.
Well, like roof and roof, or roof
Yeah.
and roof, or
Eczema instead of eczema.
Yeah.
Exactly. Well, I call it eczema.
That's what we call it. Yeah.
what about aluminum?
Aluminium.
Aluminium.
I hate all that. I don't like that one.
Yeah, pineal, but pineal is I would say appropriate.
How do they come up with these names? Only in lawyers and doctors come up with the weirdest.
Well, actually, if you look at the Greek literature, pineal has like they break it down actually as to like what it stands for, and it does translate out to like pine. It's pine. I can't recall. I have a couple articles that state what specifically it is, and the reason that it is pineal is when you break it down with the Greek literature, it identifies like the shape of it, and so it's like a tiny pine cone shaped endocrine gland. They call it like the third. They could call it the third ventricle if you wanted to call it that. Like they've got a few different terms that they reference for it, but you can actually break down like where the name is derived from. Yeah.
So are the Greeks really that much more advanced historically, like I guess the ancient times, and that's why we have a foundation of...
Yeah, like I mean, when you look at literature and history, like it's dated, like this isn't new, you know, and if we look back to fundamentally like where the language is coming from, and you know, and you pair that with what's the right word? Like phonetically how you say something, then they take that and that's through their translation. But yeah, like you can go back as far as Descartes, and I actually I found a really, really old original Descartes copy, actually just when I was in Charleston to see Dr. Patel in this like old bicycle or used bicycle bookstore, and it's like new, used, and old books. I love books. I read like a ton, and I don't like audiobooks because audiobooks are... I like it in my hands. I like feeling
the hard copy.
Papers. I like you know. And
oh yeah.
Anyways, yeah. So when I was searching like the derivative of pineal, I came across this like reference from Descartes, and he was talking about it. So if we look at how old Descartes is, like, you know, there's lots of solid.
That's
history.
Interesting.
Yeah.
The history of it, like the origins of how we got to where we are now with wording and.
Yeah.
Just about everything, I guess.
Yeah. And like, if you can hold that language to break it down to what that actually means, it's very unique in like what it can tell you. Yeah.
Huh.
Yeah.
Cool.
Yeah.
Well, I'm going to get things going. I'm going to hit record there. And might as well just start out with welcoming you to the studio, Michelle Worton.
Hi, Kevin. Thank you.
Man, you got a hell of a story.
Yeah, I got a little bit of a human experience to expand on.
You're telling me. Why don't we start out with me just kind of going through like a bit of an overview?
Yeah, of course.
And then we can just kind of go from there.
Sounds good to me.
So obviously, Michelle Worton from Fort St. John, BC, found her life taking an unexpected turn after a second COVID vaccine in December 2021. And what followed was a medical mystery that led her to confront a rare brain condition, a symptomatic pineal gland cyst. So pineal or pineal? We were talking about, I guess that word could be used.
Pineal.
Pineal.
Or pineal.
Pineal.
Depends on.
All right.
Yeah. Tomato, I guess
Yeah.
is where we're at. Yeah.
So the cyst is rarely symptomatic. However, when symptoms do occur, they are difficult to attribute specifically to the pineal cyst. Typical symptoms include headaches, eye movement problem, vision disruption, short-term memory loss, and okay, can you pronounce that one for me again?
Yeah, hydrocephalus.
That's right.
Hydrocephalus.
So, and that's fluid back up in the brain, around
That's
the
right.
brain.
Yeah.
But this story is not just about one person's battle, but it's about the community that rallied behind Michelle and Michelle's determination to seek answers, regain control of her life, and help others facing similar issues by bringing awareness through her story. So does that kind of, condense it quite a bit, but...
Yeah, that feels pretty fulsome. Yeah, for sure.
Okay.
Yeah. Nailed it.
There you go. I like that. Nailed it. So I guess, where do we start with this? I guess at the end of the day, I'd like to start from the beginning, but before we do that, it's general overview.
Yeah.
This is about, I guess, a condition that you are experiencing that progressively got worse, but started right after your second COVID-19 shot, is it not?
Mm-hmm. Yeah. Work in healthcare and, obviously well-versed in like education, 20-year seasoned and all the things. And, took care of myself, and, fitness and nutrition and all the things. And active mother, 2 children. And kind of came to a crutch at the latter end of 2021 where, the shift in COVID vaccine mandates in British Columbia specifically really kind of came at us full force. And up until, that last quarter of 2021, I was still yet to be vaccinated. I was with the COVID vaccine. I was looking at, testing almost every day, or if I was symptomatic or felt, like a sniffle, I would test. So I had piles of COVID tests at home and yet never positive, and, kind of doing my due diligence in the way that I felt was most appropriate, because I just couldn't see the efficacy of the COVID shot. So it wasn't favorable. And then things changed at the latter end of 2021, and BC Minister of Health changed that course of action for, all regulated healthcare professionals in British Columbia. And
for healthcare workers outside of long-term care, so in acute care and community care. That order is posted now on the PHO website, and it is broad. It covers healthcare workers that are staff for our health authorities, the PHSA, the BCEHS, Providence Healthcare, anybody who works for the Ministry of Health and Mental Health and Addictions, as well as employees, contractors, and health professionals in the community. So I want people...
And that's when the heat turned up. So being a member of the College of Dental Hygienists Board, we were privy to earlier information that the mandates were being enforced. And as a college board member, there was no voting capacity to whether or not we would do this. This was a direction, period. No questions asked. Bonnie Henry was going to be directing us that all of our registrants had to vaccinate by the end of 2021. And so, we had those meetings, and I looked at, not wanting to have to make that decision, but looking at my livelihood, and I own my own practice. And so, mid-November, I got my first vaccine, and, it was super challenging. There's a lot of morality, in my opinion, that I had to go against that, took a long time to like work through in a process that I had to work through to come to terms with having to make that decision.
So up to that point, there's a lot that was going on from the beginning onset of COVID-19 to, the point of where you had concerns about whether or not you wanted to take the vaccine shot in itself. So what for you was little alarms or red flags, so to speak, that caused a moment of pause for you to kind of just say, okay, this isn't something I'm 100% buying into, and you wanted to kind of evaluate a little bit further?
Well, when you look at I've never, to be honest, I had the flu shot once in my life, and I really just viewed this as a respiratory, transmittable virus similar to the flu. So personally, I'm not a compromised individual. I have no systemic disease. I don't have any so I didn't see it as favorable for me because, when we look at vaccine purposes, historically, it's a collective approach for like the safety of the public. But as I could see people being vaccinated, they were still contracting COVID. So if you get vaccinated, is that not supposed to protect you? So that was my very first observation. And then looking statistically at the variants, and but we have an inoculation that's tailored towards one strain, and yet as fast as they're coming, their new injections are coming, and to me I was like, this is not a vaccine. Like a vaccine is like a evolving within a short period of time approach, right? And like, how do you have data to even have it that vaccine delivered that would be effective against the said strain if you just don't have enough information? Yeah, it just didn't fit. Like the numbers didn't fit, the reduction transmission didn't fit, the virulence of the virus didn't fit, and I mean, if you put up enough markers and enough barriers, disease mutates, and that you could see that, you're giving like a hurdle, and now that's a mutated disease, and so we're not treating it appropriately. I felt safer personally doing the COVID testing if that was necessary, knowing that I was symptomatic, and that I felt was the better approach to protecting the public, right? Especially, I work in your mouth, and so if you look at like the highest exposure, I'm it. Being
a dentist, hygienist.
Yeah, being a hygienist. Like I look at not dismissing people that are in the medical system, like in the hospital, but like you're dealing with people, and unless they're coming and coughing on you, then of course.
Direct contact. You're in their path of breathing.
Like you're like little, you're here, you're pretty close to me. I never got COVID till like July of 2022. And I worked in people's mouths for like a significant, from 2020 all the way through until 2022. I was second shot December 2021. And I never exhibited any concerns in the slightest.
Did you have COVID before you took the first vaccine shot?
No, not once.
You had it afterwards?
Yep, I didn't test positive, and I probably took at least 20 tests given me doing my due diligence. I had my staff do the same. I was first vaccine November 14th, I believe, 2021. Heart palpitations, really high erratic heart rate after that. That settled down. And then, of course, at the time, they went from like, oh, you should wait for 3 months between injections. And then they really expedited that quickly in the last quarter.
They shortened it.
Yeah. When
down to, what was it, 2 weeks, I think?
Yeah, I think so. Yeah. I waited 5. And the reason that I waited 5 was I was obviously not feeling very comfortable with the decision. It's not a decision. I don't know what else to say, but it didn't feel like a decision.
You mentioned something earlier that kind of speaks to that I thought was real interesting about moral injury. Can you explain that again? Because that was the first time I heard that term.
Yeah. So part of my second dose, or when I got the second shot, was December 16th. By the 18th, full-on neurological irregularities. Like it was just so very unusual. I was like, whoa, what's happening right now? But in my mind, I was like, okay, it is common for people to have like high fever or whatnot from the flu vaccine or whatever. So I was like, okay, well, at least if I'm doing it now, my clinic is closed for 2 weeks. Logistically, this makes sense to me. And from my understanding right now, by December 31st, 2021, I was like, okay, it is common for people to have like high fever or whatnot from the flu vaccine or whatever. So I was like, okay, well, at least if I'm doing it now, my clinic is closed for 2 weeks. Logistically, this makes sense to me. And from my understanding right now, by December 31st, 2021, all regulated healthcare professionals in British Columbia have to be vaccinated to be able to maintain your license. So that was my logic of, you don't have a choice. If you want to keep your job, if you want to keep the license you have.
I think if any other way, it would be called, it would be considered workplace harassment.
Correct.
Yeah.
Absolutely.
Coercion.
I felt coerced. I did. So, second injection, December 16th, and we pushed forward, and here we are today. Somewhere around National Citizens Inquiry is like a collection in Canada that there's a movement that they're kind of like having people similar to myself who have had COVID vaccine related injuries, their testimonies. So they're going nationally and they're sharing this information. And so I came across a podcast or a information session with a few kind of key players. And one was a paramedic, and there was like a lawyer and a doctor and a few others that were on that panel. And they talked to her. And so she's a paramedic, seasoned, similar to myself, over 20 years experience. She's in Ontario. I think she was in Waterloo. And so what they were talking about ultimately is the burden on the healthcare system, and how we don't have the same intake for like, what am I thinking of? Med school. Like there's attrition. So there's the med school attrition. I've seen tremendous attrition in dentistry, dental hygiene, dentists, you name it. And so she was talking about that specifically. So she chose not to vaccinate and she retired. And so then you fast forward to like whenever she went back to work. So she went back to work, and so now she's working alongside nurses that are there that are vaccinated, herself not being vaccinated, but still now she can work with them. And then her colleagues, nurses that didn't vaccinate, they are still not allowed to return back to work. And so she spoke specifically to the vaccine rate in Canada in October of 2021, and it was around 80%. So somewhere around 80% was the vaccine rate. It might have been, somewhere around 80%. And so around the latter quarter of 2021, like 80% of healthcare professionals in Canada were vaccinated. By the tail end of 2021, Trudeau bragged about the 97% vaccination rate of healthcare professionals in Canada. Maybe it was entirely in Canada. And so what this paramedic talked about was that difference between, we'll call it the 80% to the 97%. So we essentially have like that difference of percentages of healthcare professionals in Canada that did not want to vaccinate. They knew it wasn't working and they knew it wasn't effective.
But they were in a position where they felt they had to.
They had to, because it was like every regulated healthcare profession, you lose your job or you're not. And like, I'm sorry, like I'm a single mom. This is my primary income.
Absolutely.
Not to mention I've worked my entire ass off in my life doing something I love to do. Like I love it, like I built my own clinic. Like I genuinely love everything about it. So yeah, like
it's not just a career, it's a passion.
It is. And I'm like, I'm just gone, and that's going to go. I'm like, oh my goodness. Right. Anyhow.
So morale injury encompasses people that are at work now that aren't performing as well as they used to because they felt that they were in a position where they had to take the vaccine shot.
Yeah.
And because of that, there's a little bit of self-shame or broken morale.
Correct.
And they're not willing to engage in the workforce as much as they used to.
Correct.
Because they were forced to take something. And now the system isn't something that they feel a part of as much as they used to.
That's right. Yeah.
Okay.
And they feel, so that X percentage that she discussed, so 17%, are morally injured individuals where they've went against their moral compass. And so similar to myself, where they loved serving. Like you're not going into, if you're going into healthcare and you don't care about people, you're going into it for the wrong reason, and unfortunately I'm witnessing this, which is really heartbreaking to see as a healthcare professional, because I always said if there was a period that I never cared and I never was like committed, I would never do this. And so obviously I'm not there yet, despite this moral injury, if we call it, on top of everything else.
I mean, it's an interesting
It's a
phrase because
super cool, interesting terminology, right?
Yeah.
Because like I've had other healthcare professionals comment on, them working in long-term care now alongside these people. And she's like, gosh, Michelle, like they just don't have the work ethic. They just don't care. And I asked her, I was like, how old are they? And she's like, well, I don't know, probably like 40 to 60. And I was like, you just went into being a healthcare aide like a year ago. And so, but you chose to vaccinate because you felt it was in your best interest. You're entering this workforce, now. You're working alongside 20 to 30 year seasoned professionals who vaccinated to keep their licensing, and they're broken, right? They're really upset. So like, they don't want to put the extra hours in. They don't want to put the OT in, they don't want to go above and beyond because they feel like they're working for such a broken medical system. And in turn, they've also had to make these decisions that they just aren't happy with, And so, and then if you speak farther to that, then you now have like physical vaccine injury that is being ignored because people don't want to talk about it.
Well, they were also, a lot of people felt that in not doing it, there was a little bit of public shaming. Polite society would really turn on you as far as if you didn't agree with it or you questioned it.
Yeah.
You were under attack, and follow the science was only if the narrative followed what they wanted you to do. And if you look to other medical advice that voiced any kind of difference in that, then whether or not it was coming from, I think, a well-educated, well-founded position,
For sure.
like some very renowned doctors.
Oh, Malone.
Or Dr. Malone is a prime example of that.
Yeah, I mean, he's founding there with mRNA research.
Robert Malone.
Yeah.
He put his career at risk and spoke against it. Now, if you listen to that person, because even though he was renowned up to that point, boom, you're conspiracy theory.
And
so it didn't matter who you were.
It didn't, and like somewhere along the line, even considering that information is wrong. Like, when did that become incorrect? Like, when did like digging in deeper into information and research become like a problem, you know? And I, Kevin, have been shamed like from every angle you possibly can imagine, except for like the center root of my family, right? Like there's a few core people that are like, we got you, but yeah, like, I mean, I was shamed by nurse practitioners in town. I can't believe you're not vaccinated. You should be ashamed of yourself. Nurses that, chatting along the lines of certain things and like, you're not vaccinated? What? Holy cow, Michelle, I can't believe that. Like, you work in like healthcare, like you're not vaccinated. I was like, I do like the COVID test every so often. Like, I'm doing my due diligence and this isn't regulated. Like, I'm not putting the public at harm. Like, if I'm not well, I stay home. But to have that much affliction, you're just like, whoa, like, why is there so much division over what should be this choice, this free choice for the best of our bodies? And I'm not an anti-vaxxer. Like, I'm vaccinated with all my childhood vaccines. I never got the flu shot because I just didn't see that it was suitable. My children were vaccinated up until this point. I absolutely did not vaccinate my son for the updated Hep B in grade 6. I don't have trust in this system. And now having an experience,
it's too bad you have to give a disclaimer like that before you give the reasons for a choice you made.
Oh, why?
Yeah.
Why? Right.
Well, you were mentioning earlier too through our conversation that your medical clinic that you had at the very early stages, you went on the side of caution and you shut the clinic down just to try and get a better grounding and understanding of what's going on.
Yeah.
So I think the respect and I think concern for the general public and also for the people that you had working within your clinic was at utmost priority, wasn't it?
Absolutely, it was. Yeah, it was the earlier parts of 2020 and the Pacific Dental Convention in Vancouver, which is like one of the largest dental conventions in Canada. I didn't attend, but my colleague did, and I was out of service at Liard Hot Springs, and I came back into service in Fort Nelson, excuse me, on the Sunday, and my phone just like exploded. And it was like colleagues that own practices in different areas of the province. Like, did you go to the PDC? Oh my gosh, have you seen what's going on? And I was like, what are you talking about? And I was like, oh no. And so I immediately phoned my associate and I was like, doors are closed. Like, until we get a handle on what's happening, doors are closed. So emailed all my clients.
And you were one of the first, or where were you in that process?
I was the first practice in Fort St. John to close. Yeah. I was like, I am not, unless we absolutely understand what is going on. I'm not going to be reactive. I'm going to like be proactive. I'm going to
go on the side of caution until you get a little better grounding and understanding of what's going on.
Yeah. So that was the very first stages. So if you want to look at my approach of public safety and protecting the public, like I can't think you can get any more directed than like, let's just box this up and like, let's get the information we need. And then let's move forward and make a very wise decision with all of the information we have.
So moving from that point, I guess, up to the first, when you had to take your first vaccine shot.
I'm shaking.
Are you?
Yeah, it's okay. It's my I say I have like
Is that because you're super excited right now, or?
It's a little bit of both. I like joke and.
It's one of the symptoms, isn't it?
It is, yeah, tremors. So like, sorry if I don't want to offend you about talking about Tourette's because I know it's a thing, but I don't have Tourette's of my mouth. I just have like Tourette's of like my winking face and my hands. Like it's just like in.
Well, I'd like to note the glasses. You must have a light sensitivity too, and you gotta. So that's the reason for the glasses.
Yeah.
I can't turn the lights down much further than they are now.
No, I got my hat and like I have earplugs and I have my glasses and light sensitivity and there's a lot like depth perception, and now I have like I can look at you straight, but in order for me to look down, I have to turn my head down because my eyes won't move that way anymore. Like it feels, I don't know, maybe if like you'd imagine like a tendon that keeps your foot restricted. I'm not sure how else to explain it, but it just the mobility is not the same with my eyes anymore.
Do you have the ability to move your eyes, or is this just strenuous to do that, and are they fused or locked in place?
They are pretty close to being fused to that position.
Wow.
Like for me to like try to look up or look down now, it hurt. It feels like it's pulling. Like it feels like
my goodness.
It feels like you've overstretched something that you're trying to like move.
Is that a neurological thing?
Compression, neurological. There's a sequence and a specific constellation of symptoms that are associated with the pineal cyst that I have. Should you have it, and should it be symptomatic? And part of that is whether that's like, which is done through research, which is part of when it does come out. They look at the chemistry of the tissue. So a cyst is a fluid-filled sac. You can have cysts in a wide variety of your bodies. Generally, they're symptomatic. You can have ovarian cysts, or you can have cysts on your liver. They're in your breast, like varieties of areas in your mouth. In my experience through dentistry, typically when you have a cyst, because we can see cysts that form around your wisdom teeth, there's a 5% chance per cyst in your body of it becoming a tumor. So we monitor cysts because you want to see if they change, right? If the tissue mutates. And so with a symptomatic pineal gland cyst, whether it is a pineocytoma, which is a tumor, so we don't know that. It appears that it's not, but it'll be biopsied when it comes out. So the tissue will be tested, the chemistry will be tested, and they'll compare that to the bank of cysts that Dr. Patel has removed, and they're trying to look at that to understand why. Like, why are these cysts forming, and why are they becoming symptomatic? So you can have them and they're not symptomatic, or you can have them and they are. Interestingly enough, size has nothing to do with it. So you could have one that's large and it can cause hydrocephalus very clearly. So fluid buildup on the brain, compression of it's a tectum it's called. And so there's issues with like your ocular nerve, so the nerve you see conducting information is impaired. There's compression because you imagine you have a marble inside your head that's not supposed to be there, or a cyst that's taking up space in a gland that it's not supposed to be. So there's no volume. So you have no volume to produce like the chemicals in that gland that regulate your endocrine system. So your endocrine system is everything. It's your female hormones, it's your thyroid, your parathyroid, your testes, your ovaries. Melatonin is the primary hormone produced in the pineal gland, and that regulates your entire endocrine system. So if you have a symptomatic cyst, something is wrong with the chemistry inside that gland, and as a result, the snowball effect is that all of the other hormones in your body that are affected would then cause issues with other organs in your body, primarily the neurological system. So whether that's like a compression in this area, so your vision is impaired, like I have primary symptoms right now, because I've gone through a whole sequence of symptoms, are nausea, dizziness, vertigo, cranial pressure, crazy head pressure, every day, all day, pain, every day, all day, double vision, blurred vision. I've recently lost most sight in my right eye. It's not clear anymore at all. And I've lost my peripheral of my right eye. Unable to like move my eyes properly now. My short-term memory is terrible. And my word finding is challenging. My kids write their names on stuff for me now. They write their names on their lunch kits because I fucked up their lunch kits for so long.
Your short-term memory is that affected from it, eh?
Yeah. So like
you sent me a list of some of the symptoms that you had. By the way, just on a side note, good job with record keeping. Oh my goodness. Like all the stuff when we were talking originally and I'm like, oh, if you can just send me some information so I can kind of get prepared for the episode.
Yeah. Sorry.
Oh my goodness. No, it's better to have too much than too little. And I was absolutely amazed at your ability to break everything down and the record keeping. And one of the things that you shared was, I guess, all the symptoms and some of the things that you were experiencing. And the list was just, it was huge, absolutely massive, like a full page in small font of all the different symptoms that you have to deal with. And that's a daily, ongoing, continuous basis. Honestly, everything started within
2 days of the vaccine. And then it just didn't stop. And it wasn't somewhere around September, October of last year is when like it really stepped up next level. Initially, it was just like hot spots in my legs, brain fog, blurred vision, my heart rate absolutely erratic, like dangerously erratic. Like we went into the backcountry alpine skiing was like the last time I was there, and my heart rate was close to 200 beats per minute. And my partner and I were like, we got to get out of here. Like, I don't know what's going on and I'm not chancing it. And then it started with the tests. Like I had blood work, about 4 weeks after the vaccine, I ended up in emergency with kidney stones. I was like, what? My CK levels and creatine levels were through the roof. I was like, what is happening? Why? They're like, oh, well, too much protein. I was like, nothing has changed in my life.
That's one of the biggest things. And I'm sure you've probably heard the first thing is, well, how can you attribute that to the shot? Causation isn't, or relation isn't causation. And I'm sure you've heard that, like the question, well, how can you attribute this to the vaccine shot?
Yes.
So one of the biggest things, like what we had touched on, I guess earlier, that I kind of took away from was the fact that you're very active. You go to the gym, you're outdoors, you had a lot of health, healthy lifestyle. Yeah. You didn't have much for health, pre-existing health conditions that you knew of. No. Some people, I don't want to make this offensive to some people or not, but some people are just kind of sickly.
Some just don't live a healthy lifestyle.
Yeah. And so that was none of the issues that you had. And then you said 2 days after the second shot. Did you have any kind of symptoms or anything in between the first and the second?
My heart rate was really erratic after the first one. That was the only thing, like tightness of my chest and heart rate.
And that was just something that you're like, well, there are always little things
Yeah.
that you like a
it's
sore
hot.
shoulder
It was like
or
a little-
something.
Yeah, it was a little hot and whatever. Like I was like, I didn't feel great. And me, foolishly enough, I guess, I'm right hand dominant. So in my opinion, I was like, okay, well, you can have like tightness of the muscles with a intramuscular like injection. So I was like, okay, well, I'll do my right arm because I use it all the time. And the more I use it, if it's sore, it won't be as sore. So stupid me, I'm like right hand dominant, and that's the arm that I did it in. And I don't know, I don't have any issues seemingly with like mobility. But I don't know. I just did that. I don't know why my mind went there, but sorry. Woo, squirrel. Welcome to short-term memory loss. Anyways, heart rate. Yeah.
So
yeah,
heart
just the
rate was
and
the only
then-
thing between the two shots.
Yeah.
And then after the second shot,
Yeah.
the first 2 days seemed to be fairly normal.
No, I wasn't.
Or-
I wasn't amazing, but I wasn't great. And then I was like, "Whew, man, I don't feel good. Like, ugh, I really don't feel good." We're right in the middle of Christmas holidays, and I was still like, "Oh, I don't really feel great." And a couple of weeks went by, and I called who was my medical attender or whatever the case may be, medical professional at the time, and sent them a text message. I was like, "Hey, like I really don't feel good. I got my second vaccine," and she was like, "Oh, okay, well, like let's get you in for blood work." So like somewhere around the 12th or 14th somewhere around the second week of January. So it had almost been a month, and I went in and I saw the family doctor who was assigned to me, not the individual I spoke with. I didn't see her. And I went in and I was like, yeah, I had my second vaccine. I really don't feel good. I have this hot spot in my leg, and I feel like, like brain fog and vision and dizzy and dry mouth and my heart and, and he's like, oh, menopause? And I was like, excuse me?
Oh, that was his.
I was like, pardon me? And he's like, menopause? I was like, you've got to be kidding me right now. I was like, I just had my hormones checked in June, actually. Like, I might actually want to have another baby. Like, no, this is not menopause. I was like, you've got to be kidding me. And then it just started. So then it was like,
Well,
hey,
did he do any more follow-up after that? Like after that question, was there anything else that he did?
no, it was, we were unsure as to what was wrong. So blood work was ordered, MRI was ordered, and that's where it started. And so when you looked at my blood work, which is funny, when you looked at my blood work from the middle of January, and then I ended up in the hospital at the ER with kidney stones, stayed overnight because they had to do a CT scan. So they did a CT scan. So they did the CT scan and saw the kidney stones. I had already passed them. But incidentally, they said you have a whole bunch of cysts on your liver. And I was
Wow.
like, okay.
And this was what the CT scan.
This is the CT. Yeah. You need an ultrasound on your liver now. I was like, okay. And then I had my first MRI on my brain. But then I started looking at my lab results from the first week of January. And as soon as you looked at them, you could see my CK and creatine levels are through the roof, which tells you your kidneys aren't functioning properly. But the doctor didn't even look at them.
Really?
They were like screaming red, like they were elevated, like something was wrong with my kidneys in the middle of January. So 4 weeks after that vaccine.
So you're looking at this report, and did you have a consultation or like a review with your doctor?
Zero, nothing.
How did you get the records?
Printed them off my e-file. So like in BC, you can get on e-file, Healthy Link or Healthy File. So it's your file. So in January is when you talked to me about, remind me to come back to the first MRI.
Absolutely.
So when you come back to like record keeping after January 2021 or January 2022 started all the investigation process. We fast forward all the way to January 2023 of this year. I finally see the MS specific, so multiple sclerosis specific neurologist that I had assigned to because they thought I had MS with my neurological symptoms. It's not menopause, now it's MS. But it's not the vaccine.
Funny how it changes.
Yeah, but it's not the vaccine. And so...
Did you ask that, not to interrupt you,
Yeah.
but I mean,
Yeah, specifically.
that's one of the things that I've always kind of been a little bit puzzled by when someone is able to exclude something, but then when you say, well, what could it be? They're baffled and they say, we have no idea. Well, if you have no idea, well, then how can you kind of exclude a certain, I mean,
Right there. Like, where did it become not okay to say that you don't know? And then be like, but let me look into this further. Do you know what I mean? Like, that was my thing. Like,
we have no idea what it is, but it can't be this.
It can't be that, Michelle.
What's the reasoning behind that?
There was no reasoning. Like, that was the hardest part. There was no reasoning. So in January of 2023, I finally got the last appointment with a MS specific neurologist. And she said, you don't have MS, but you need to see a different neurologist so that they can like help. And they're more specific to like chronic pain management is what her direction was. So around there is when I went on my Healthy Life from BC that you can print. And I printed every single one of my medical records from like November of 2021 until present day. And then I phoned the medical clinic in Fort St. John and asked them for my records. And they said, we need to see if we can give them to you. And when we do give them to you, these are confidential. And
your records.
My records are confidential. And if you look at what I sent you, it says right on the bottom, like about the confidentiality blanket around my medical records. And then I phoned the MS clinic and asked for my medical records because I knew the neurologist wrote down post-vaccine, post-COVID, or chronic migraines. So that was her primary diagnosis of me. So she said I didn't have MS so they did that. So yeah, so then I asked them. So then they had to make sure that they asked her if I could have my medical records.
Wow.
And then I finally got all my medical records. So as I've been going through this process, I started before, because like my short-term memory and my speech and my cognition wasn't really impaired. Like it really got impaired kind of around like February 2023 of this year. Like that's when it like switched. Like all of 2022, I was like, man, I don't feel good. Like my eyes weren't quite right and my balance was weird. And I would like move myself on my dental chair, but like I would still feel like I was sitting in my chair, but I was like way over here. Like,
oh, really?
I wasn't like tracking. I was like, what is happening? So then I would start canceling my clinic days because I was like, I can't do this. And then kind of around.
So that's when the symptoms got to a point where you're able to work, and then that was the threshold from where it got so severe that you can even
stop
work.
working. I stopped working in February. February of this year, I stopped working.
Of 2023.
Yeah, but I kept collecting data and printing everything and started looking into research. And so February of 2022, I had the first MRI in my brain, and it showed that I had a lesion, like a white matter lesion on my parietal lobe. And so parietal lobe is like your cognitive processing lobe in your brain. And so I had to have another follow-up MRI in August to compare the results. In the meantime, I was also waiting for a liver ultrasound as well from the CT scan. So you imagine me.
So how did so the hop skip in here went from kidney cysts?
Yes.
To, I don't know where the connection is, but MS.
So kidney stones. Liver cysts. Brain lesion.
Okay.
Maybe MS in like less than 2 months from like nothing seemingly wrong, that I only had babies and delivered them and had a few weird things after children.
Wow. So were these from different tests that they had you go back to take?
Yeah. So then it just started. I was just like, what is going on? I was just like one system after another was not happy in my body. So I talked to the MS specific neurologist in 2022, and she said, I don't believe you have MS. And I said specifically, can this be from the vaccine? And her response was very vague, but it's documented. And it said that there is a correlation between patients that have had the vaccine and neurological symptoms, but I wish I could find the right language. Correlation. There's no, not correlation. The pathway of why the neurological symptoms are happening post-vaccine, they don't know the pathway. Okay. They don't know what is happening, but it's happening, but they don't know why. I was like, okay, somebody wrote it down. Yeah. I need that piece of paper, right? So then I had my second MRI in August. My family doctor, had the MRI and had the ultrasound. The gentleman who said I have I'm in menopause. The doctor that I said I was in menopause, talked to him in like September of 2022, and he called and he said, okay, Michelle, like your MRI is stable. The lesion is stable. And yes, you have like a variety of cysts on your liver, but we're not worried about them. And I was like, so I don't need anything else. And he's like, no. I'm like, nothing else. No other tests. Nope. I was like, I think that's super weird, but okay. You're the doctor.
Were they prescribing anything during this time for? Yeah,
so they prescribed me amitriptyline, which in low dosages can be used to interrupt like a pain cycle. In high dosages, it can be used as an antidepressant. They recommended magnesium. The neurologist went through recommending like nutrition and hydration and fitness every day, which if you look at seemingly my life, I kind of laughed on the inside. I was like, okay, sure, I'll do that. And what else? Sumatriptan. So it was like an emergency migraine medication. And I said to her, I have maybe had 2 headaches in my entire life. This is not chronic migraines. This is not post-COVID because I've never had it. The only common thread is the COVID vaccine. That's it. So I'm not taking your migraine medication because you don't know what's wrong with me. So I'm not going to take something if you don't know what's wrong with me. Like I don't take drugs.
Well, then it muddies the water when it comes to symptoms. Like
exactly.
What is a symptom of some of the medication you're taking versus the symptom of exactly what the root cause is?
And if you look at the amitriptyline side effects could cause the sequence of some, not all, like the cognition, the memory, and the ocular disturbance are very, very specific to pineal cysts, symptomatic pineal cysts. You do not need the presence of hydrocephalus to warrant the reason why you would remove it, because it's that presentation isn't so specific. There's that set collection that is specific, and so I was like,
just data markers to be able to say that it's something specific. It's not a byproduct or a side effect of maybe something else that you might be taking.
Yeah. So somewhere around like September, October of last year, I just was like, what is going on? Like, man, what is going on?
Well, you must have been almost frustrated with the fact that some of the responses that you're getting is almost discrediting the fact that you have a pretty good understanding of how you feel yourself.
Yes.
Like sometimes when something's
wrong.
Not only wrong, but it's more than what you understand. Like the way people feel naturally day to day, you get used to that certain feeling. And then when something's wrong, you're like, oh man, okay, this is actually something that I should take seriously. And I'm sure that's a lot of what you're feeling.
It is.
Have you felt, not to interrupt, but have you felt, and I want to discredit or a point, not discredit, but I want to kind of take this on point, because I know that one of the things, and you had mentioned this earlier, so that's why I'm addressing it, is that when you're going through some of these symptoms, people's response and body language is, well, you're exaggerating or you're trying to manipulate something into something it isn't. You're elaborating, or you're trying to misguide, and you're fixating on the fact that it might be a vaccine shot and maybe it isn't. Is that true?
Well, and there's no ignoring how I felt about it, right?
Yeah.
So I can easily see the assumptions, which I don't really care. They can make whatever assumptions they want to make. But like that dismissiveness and that like judgment and like mocking, and from like healthcare professionals to like the general population. I'm not saying that, whoever has been injured, if you've been injured by the COVID shot, our bodies are all different, and we don't know from a cellular level, like what it's doing. And it might not do to you, Kevin, what it did to me.
Yeah.
We're not the same DNA, we don't have the same predispositions, right? But like prior to me being vaccinated, like I had no pre-existing conditions. Like I had nothing like, I never had to have an MRI in my brain, or, I didn't have to have like all these things I've had to have. Like, it's just like, what is going on? And so these experiences, like, you can't be so dismissive to not even entertain the idea.
No. And to try and have one solution.
Yeah.
And blanket it across all of humanity on planet Earth.
Yeah, yeah. Well,
when you have all these different biological differences from one to the other, and why one person might be more susceptible and one other person might not be.
Yeah, yeah. Like if you look at cancer, for example, like we have cancer cells in our body. Environmental exposure, toxins, whatever the case may be. Those are pieces that fit together with your experience, your human experience from exposure, and can either be a catalyst for cellular mutation and changes, or it's not. So like, you could have cancerous cells and you never develop cancer, but you could have cancerous cells and you and I are exposed to the same thing, but all of a sudden you develop cancer. Like this isn't new science. This isn't new. So if you take that same concept and apply it to a vaccine, which was not very well researched and really implemented very quickly, like on a mass effect, like how can you not even question that? And then on top of that, there's human error, right? Like there's like transportation issues. There's like freezing requirements, like there's mobility issues, like there's different lot numbers, there's different batch numbers. Like when I started actually really looking, because like ultimately I didn't want this to be vaccine related. I just wanted to get better. I just wanted to get better. I don't want to be sick. So for me, I'm just like, please don't let it be that. We just checked off every single box and it came back to the same root cause, right? And exactly. I have an amazing family doctor in Calgary. Man's a godsend.
What's his name?
Dr. Alex Lubiska is his name.
Shout out to Lubiska.
Yeah, I got connected with a friend that's in Calgary, and after the is it menopause conversation, I was like, holy crap, I'm in trouble, and she was like, listen, just get a hold of Alex. So I connected with him, and he was like, hey, Michelle, like I actually have probably about 10 patients that are similarly going through what you're going through. So I've asked a few questions in Alberta, and they don't particularly like the questions I ask, but I'm not so removed that I won't consider this for you. Let's hope that in 4 to 6 weeks, your immune system calms down and everything is good to go. Fortunately, that didn't happen for me. So he's followed me through, and he has got other siblings that are physicians, and so he leaned on them, and then initially the diagnosis came back to like POTS, which is posterior orthostatic tachycardia syndrome. So that
wow,
yeah,
it's a mouthful.
It's a mouthful. So posterior is posture, upright. Orthostatic again is upright and your ability to stay upright. Tachycardia is a regular heartbeat. Syndrome or tachycardia is high heart rate. Syndrome is a collection of symptoms. Orthostatic also references to like your inability, so I'm going to get all technical, for your
it's good.
autonomous nervous system to regulate. So your autonomous nervous system is regulated from your brainstem to like your vagus nerve and your vagus nerve is the largest of the cranial nerves. And so that regulates heart rate, digestion, breathing, respiration, everything in your body. So if you have something that interrupts the signaling of your nerves to communicate with this said organ in your body, it's dysfunctional and it's diseased. So that happened. So they say, Michelle, you have POTS. So MS clinic says, nope, you don't have MS, you have chronic migraines. This is what she says. We fast forward to like the winter of early winter this year, February this year. And still it's like, well, why? Like, why? Right. Yeah. And so Dr. Alex was just like, the only thing we can come to, Michelle, is that you were vaccinated. The vaccine disrupted your autonomic nervous system. We don't know exactly what is not working properly. And because it's disrupted, you have all of these symptoms. I was like, what do I do? So it's like,
well, you kind of you got at least one little step in the right direction.
Yeah. And he's like, but it's the vaccine, Michelle. He's like, this was like August or April of this year. Because we tried everything, and he's a godsend, I'm not kidding. And so he signed my vaccine injury claim form, and we submitted it in April of this year because
Submitted it to who?
the government of Canada.
Oh.
Yeah. So it's approved. It's not approved. It's accepted. So there's legitimacy to what I'm going through. And so we took all my data, we sent it to the vaccine injury claim. So this is a physician in Canada. And so he's agreed with what's happened because he's walked with me through this whole thing. All of my stuff in BC that I get, I send it all to him. Everything goes to him. He gets all my MRIs. He gets all my blood work because he's the only physician in Canada that's listened to me. And he's incredible. So he's like, he's like, I'm going to say POTS because you have this collection of symptoms. What exactly in your body that's damaged? I don't know.
Yeah.
I don't know.
Still not to figure that out.
We don't know, right?
Yeah.
But this cyst is looming. This brain cyst is like looming. It's over here somewhere, you know? And so I get a phone call in November of last year from the MRI booking clinic here in Fort St. John. You need to come in for another brain MRI. I was like, I thought I didn't need one. She's like, you do. The MS clinic said you do, like now. I was like, okay. I go in, get the MRI. I don't hear a thing. I'm not okay. I call the MS clinic. I'm like, do you guys have like any information? Like, I am not good. Like, if there's anything else I need to do. And they're like, actually, the neurologist wanted to see you. Now this is like the middle of December. And I was like, well, it's December and I haven't seen her. And they're like, yeah. So January. I was like, okay. And the nurse, the gentleman was like, but let me look at your MRI. And by this, I'm in Browns waiting to go for lunch with a friend. I'm still trying to go to the gym. You know, I'm still just like,
Well, this whole time I
feel like shit.
But
like,
you're still trying to maintain a level of fitness.
Every day, in my mind, I signed up with a personal trainer in December. I was like, I need to get stronger. I was like, I don't know what else to do. I need to get stronger. I need to get more muscle mass. I need to get stronger. I just need to get stronger, you know, and we had to modify things and I couldn't do things. And then it was just like, if I loaded my spine doing like back squats, like it was just like anything that loaded like my spine and in close to my neck where like all of your like brain stem and your, cerebral fluid kind of like can condense. It was just like, whoa, like it built. Everything was just like building. So the nurse is like, but let me look at your results. And I was like, okay. He's like, okay, well, the parietal lobe is stable and the pineal gland cyst is stable. And I was like, pardon me? And he's like, the pineal cyst. I was like, what are you talking about? And he's like, pardon? I was like, that's what I just said. And he's like, your pineal gland cyst is stable. I was like, I don't have that. He's like, yes, you do. I was like, since when? He's like, it says it's stable. He's like, I'm sorry. I was like, okay. He's like, your appointment's in January.
So that was when you first found out about it?
That was when I first found out. Yeah.
And what reference was he using to be able to come up with the fact it was stable?
The previous MRI that I had.
That you still had no idea about?
Then nobody wrote it down. The radiologist in Fort St. John didn't write it down. And then the neurologist that looked at the MRI, when she finally looked at it, like, so that was in August that I had that MRI done. And I got a phone call in November that I needed another MRI. So what's that? August, September, October, November. So 4 months later, the neurologist in Prince George, who comes up from Vancouver, finally looked at the MRI herself and went, oh, that wasn't there the last time. We need to double check to make sure that's there. So I had the MRI and sure enough, I saw her. And you have to also realize, Kevin, I have never seen a neurologist in person. I've never seen a neurosurgeon in Canada in person. Everything's been through either the phone or Zoom. So they're making these decisions on my life based
without any in-person consultation.
Zero. I have not seen one single person in Canada in person. No neurologist, no neurosurgeon. So she phones in and we talk and you know, I was just like, you know, explaining like, you know, things aren't good and they're getting progressively worse and, you know, I'm no longer comfortable driving. You know, I'm not coaching my kids in soccer anymore. Like, you know, and so she's like, well, it's not MS. I would say chronic migraines. I said, what about this cyst? And she's just like, I don't have enough understanding, but I don't believe that's the problem. And I was like, well, then what is? She's like, you need to see a different neurologist. I was like, awesome. So she discharged me. She was nice. Like, you know, I can say that she was nice of who I've had to deal with. And so they, their next step was to prescribe me a beta blocker. And so I waited to see this other neurologist that they referred me to in January. And I talked to my family doctor and she gave me a beta blocker to regulate my heartbeat and help with the migraines. And again, I asked her about the cyst. And she said no. And then I said, well, I want to see like internal medicine. I want to see an ENT. I want to see like what is wrong. And so she sent another referral for neurology. She tried to send ENT and she wouldn't send internal medicine. And I said, why? And she said, well, that's not how it works here. And I was like, what the hell does that mean?
Yeah.
I was like, I waited a year to find out that I don't have MS. How much longer am I going to have to wait? Like my quality of life is vanishing fast. And you are like, that's not how it works here. That was it. I printed off the rest of my reports. I started searching pineal gland. Very like article I found, Dr. Patel, worth a second look. And I read this article and I was just like, oh my God, that's like me. What the hell?
What were you reading that described you? Was it symptoms or?
Yeah. So it was, about 15 years ago, he had a woman, she was like worldly successful, lawyer, kids, active, all the things, and she just unwell. And so she saw him and his resident at the time, like she had a pineal cyst, and his resident at the time was just like, well, he's like, no, he's like, well, what if it is? He's like, what did we talk about before you and I about science?
Yeah.
Right? He's like, what if it is?
What if it is?
What if it is? So they removed it. And she came back 2 weeks later. All of her symptoms are gone. All of her symptoms are gone. Why she has a cyst, don't know. How it mutated, don't know. Why it's symptomatic, don't know. This is part of the research. They're looking at the tissue composition. They're looking at the type of cells. They're looking at the chemistry composition to try to figure out why that cyst is changing. My question is why do I have a symptomatic pineal cyst that I never was aware of before? Why do I have cysts on my liver now, my brain? And I just found out on Friday, it's crazy, Kevin, that I have like multiple cysts on both my breasts now.
It's spreading.
Come on, right? It's normal. Cysts are normal. It's normal. I'm like, nah, it's not normal.
So that's enraging when they say that.
Yeah, it's normal.
This is normal.
This is normal.
New symptom popped up. Oh, yeah. It's normal, but we don't know what it is or how it's being caused.
And the worst part is that I've had another liver ultrasound, and I go on, I print off my healthy life forms, reports from imaging. My family doctor in Fort St. John didn't even call me back. The receptionist called me back and said that that everything is stable. Your cysts on your liver are stable. So I looked at the report. I have I don't even know, 10 or 12 cysts. So more than I had before.
Wow.
They're in different lobes of my liver and they're different sizes compared to the last ultrasound.
And they were stating that's stable.
That's stable. Yeah. So they're larger than they were. The largest one is larger than, I think it's 3.5 centimeters. The one before that, the largest was 2.2 centimeters. So now I have more lobes, different sizes, different spots, and that's stable. And I went into the doctor. Because I have a super weird, tissue irregulation underneath my arm. Never had it before. So you could see how they look at you and be like, you're crazy, you're a hypochondriac. 1 in 1 people have mental health issues now. Nobody has anything wrong with them now, except they're all mental health issue related. I just have cysts, but that's mental health. You're stressed out and anxious and you're overly emotional, Michelle, yeah, okay, sure. Here's some antidepressants so that you'll just ignore us, which is what they're doing with everybody. Let's just dumb everyone down so you don't ask questions, and I'll ask the hard questions. So I went in because I was like, holy crap, that's weird. It doesn't hurt. Typically, if you're looking at lesions that are malignant, cancerous, oral lesions, I do oral cancer screening in the mouth, you look at if it's bilateral or not, so one side or the other. Typically, things that are not, not a variant of normal, you have abnormalities. So something that's abnormal is usually not bilateral, so it's only on one side of your body. It's fixed. So it's usually not mobile, and it's not usually painful or symptomatic. So that's a bad sign. So if you come across someone that has a lesion in their mouth or, in their breast or whatever, and you can kind of move it, but it's fixed and it's palpable, so you can touch it. It doesn't hurt them, and it's on one side, not the other side. Then you're like, that's weird. And so those are usually the ones you need to be concerned with. So that's a lot of times if someone presents with cancer, it's too late because it never hurt, right?
Yeah,
So you're
I
like,
see.
shit, I should have got this checked out a long time ago, and I
Yeah.
didn't, you know? And so when I saw my arm, I was like, that's weird. Like, it's only on one side. It doesn't hurt. It kind of looks like corrugated paper.
Really?
Yeah. Yeah. I'd show you. I don't want to have my bra on, but I
No,
would-
that's okay.
Yeah, I'd show you. But it's weird.
Yeah.
And so I went in for an exam, and so I saw a walk-in clinic doctor, and so she looked and she's like, well, you haven't been here. Like, we haven't done a full breast exam, so let's do one. And so she did it. And so she identified a couple cysts on my right breast. And I was like, oh man. And she's like, what? And I was like, more. And she's like, oh, they're normal. They're hormonal. I was like,
Wait a minute. I've heard a lot of that lingo before.
yeah. I was like, okay. I was like, so now I have cysts on my brain, my liver, and my breast, but they're normal.
Normal and stable.
Yeah, I was like, so what about a mammogram? And she's like, well, if you want to. And she's like, what's your history? And I was just like, well, my aunt had cancer. My cousin so my cousin, 4 months after her second COVID vaccine, they find a lump in her lymph node in her same side she got injected. She had a mastectomy, so cancer, right breast removed,
Whoa.
reconstructive surgery of her breasts. Now she's on gabapentin because she's in so much pain. She never had anything wrong with her before.
Gabapentin's a bad one.
Bad one.
Are you on gabapentin?
No. Yeah. So anyways, she said, if you wanted to do a mammogram, sure. And that was that. And, you know, so I phoned and they're like, well, if it's just like a screening, then you don't need a rec. But if it's for something, I was like, well, I'm pretty sure I need a requisition. And I was like, and I actually really want an ultrasound as well. So I just had that done like 2 Fridays ago. And not only do I have cysts on my right breast, but I have them on my left. And now I need to go for a mammogram and an ultrasound in 3 months and in 6 months to see if those change. And I requested specifically the ultrasound. So I follow a lot of so Dr. Peter Attia, he's a epidemiologist. He's Canadian, but he lives in the US. Super smart dude. And so I've been listening a lot to him, and I just read his book. It's called Outlive. And so it's how do I say it? It's like early diagnostic tools. So unorthodox diagnostic tools that you typically wouldn't be able to get unless you pay for them. So they look at like
I see.
ApoE, they look at like the genetic disposition. So have you ever seen Limitless with Chris Helmsworth?
Oh,
It's
no.
a Disney documentary.
Okay.
And they look at him, and obviously the Thor, he's
Yeah,
Thor.
oh, yeah.
He's like the strong man, and so they decided to take him, and they wanted to be like, let's look at this person who we presume is very healthy, and like, let's look at his genetic makeup and disposition and see how we can help him to prevent anything else from coming up. And so his grandfather, had dementia. And so they did like this gene testing, ApoE specifically. And if you have there's 2 different genes. And so if you have, I could be butchering this a bit, but if you have the presentation of one of the ApoE, then you increase your likelihood of dementia. If you have them both, you've got a pretty darn good chance you're going to get dementia. So his whole focus, Chris Helmsworth through Limitless, is to do all these things to eliminate or reduce the likelihood. So like ice baths, saunas, fasting. So I've done all these. I ice bath.
Preventative.
Yeah.
You've done the fasting?
Oh yeah. So I've done intermittent fasting. I've done longer fasts. I've done, because you get into autophagy where you start to starve sick cells. So if you can, if your cells are meant to live and die, and if they're too diseased and you have too many disease cells in your body, then there's a lot of cells to die,
Yeah.
right? So I mean, that's where you can have withdrawal type of symptoms, like when you
For
do
sure.
a fast or a cleanse or whatnot, right? Because you're getting rid of dead cells.
Well, not only that, but you're dependent, I think, on a lot of sugars. But in a fast, the reason I think it's so effective, and I know this just through different conversations, not because I'm educated, but you get into a fast allows cellular rejuvenation and your growth hormone spikes. And it's the only time your body's got the ability to be able to make the repairs it wouldn't normally have because of the digestive system.
So much
it's
energy goes to digestion.
Powerful way of healing. And cancer is dependent solely on the energy based off of sugar or glucose. And so when you deplete that in your body, then
You starve off your cancer cells.
Exactly. You're able to control it a little bit.
Yeah. So I started reading, read his book, Outlive, and started looking at earlier testing. And it's funny, like when you ask physicians for this testing, like they don't really want to do it. They're like, no, why do you want that? It's weird. You know, blood biopsy is another one, which is kind of cool because one of my acupuncturists in town, I shared some of that information with him and his family. They've had a few things that they've, you know, going on in their life. And so I actually went and bought a copy of the book and dropped it off to their family and earmarked like the chapter I thought they maybe should start with. And his wife was just like, you bought this for me? And I was like, read it. In the meantime, she'd already found this clinic in Vancouver somewhere to do blood biopsies. And sure enough, she gets the results back and she's got this sequence of genes that tells you why this certain medication they'd been giving her for a long time doesn't work because it doesn't suit. So it's super cool if you can actually look at like the preventative aspects of like, I guess the biggest part is like, if you have this information and you do these early diagnostics, what are you going to do with the information? Are you going to use it for good, right? I will use it for good. So even for example, like, you know, early colon screening, you know, for prostate cancer, like they won't typically do that in men till you're like over 40. Well, why not start earlier? You know, mammograms, like they won't do it till you're over a certain age. Well, why not start earlier? Like I understand the risk of like radiation exposure and all of that, but there is a component that if you perhaps have a pre-existing disposition, like your grandparents or your parents had diabetes or heart disease, if we have tools that can, what Atia coins it as is like medicine 2.0, like we're stuck in medicine 2.0 right now where we're treating disease. Well, why don't we prevent it from happening?
Yeah, we're treating symptoms instead of the root cause of everything.
That has been the only recommendation for me, Kevin. There's been no to the root, which brings me back to the pineal cyst. Why it mutated, can't tell you.
It sounds like your doctor in Calgary actually was getting to the root of where the issue is starting or coming from, but it was just a matter of trying to have a better understanding of exactly what that all entailed and the best, healthiest approach to be able to deal with it. The symptoms of all of that would be addressed. And obviously it's not being addressed because a lot of the symptoms and, you know, cysts and all these other things that are, you know, starting to develop, you know, it seems like a little quicker over a period of time. What's causing that? What is happening within the system? Now, there's a lot of good literature and information out there that is based around, you know, why the vaccine affects some people more than others. And it all has to do, and I'm not very well versed in it, but it does have to do a lot with, you know, the spike proteins and how your immune system is changed and, you know, starts to attack, you know, organs and things that it shouldn't be attacking because your body doesn't recognize, you know, hazards or things that it shouldn't be. And it's compromised in a way where I guess it could probably fall under autoimmune disease.
Well, it's
in
misreading
some form.
Signals, right? Like that there's something is interrupted, so the message is not being delivered properly, right?
That
so
will never be addressed in Canada by any kind of doctor now, though.
No, it won't be. It won't be. It's why though, right? You're right. It's not going to be. I don't know when it will be. I'm not sure. But if we are so science-based, if that's what we say, if we say we've made these recommendations based on science, then why wouldn't you look at what's happening with patients and individuals like myself to be curious enough to ask like, okay, well, this happened with this individual, you know, let's figure out why, right? Or just
not only that, but better support, because it seems like the only reason you got as far as you have right now is just because you've got two elements. One, the predominant one is your tenacity. Like you've got a very strong, you know, like, and it's to be commended. And I think a lot of people just don't know where to go or how to approach that. The second part with all of that, with your tenacity is, I think a better understanding about the medical system than the average person. And it gives you a sense of direction on the approach of how to be able to go about, you know, achieving, okay, this direction, that direction, a certain doctor, the wild array of different people that you've seen. Have you had to travel for a lot of these?
I was just going to say, so I just sent a wire transfer to MUSC in Charleston, South Carolina for my occipital craniotomy. So November 20th, I'll be having a keyhole access procedure done on the back of my skull, where Dr. Patel they'll do a spinal tap. So they'll drain the spinal fluid so that your brain can sag. And so they go in through the back of your head. And when they release the spinal fluid, your brain sags, so your hemispheres relax, and the pineal gland is right in the very dead center of your brain. So it's the centermost part of your brain.
Wow.
Yeah.
Okay, so I wanted to get into this because I wanted to figure out how you got all the way into this surgery, and the fact that it's in the U.S. and the fact it's a whole solely the cost on you.
Yeah.
You've given me, I think, probably three different forms showing how much this is going to cost.
Yeah.
The wording in it that I've read was this has to be paid in full 2 weeks prior to the actual surgery.
It was paid yesterday.
Man, and today's what day?
Today is
the 7th of November.
The 7th. So
when is this surgery?
November 20th. So I leave Canada the 15th of November for the States, for the US. Yeah.
I really want to get into this surgery, but
so money. So we'll come back to that. So
I do want to hit that. Yeah.
So I'm sitting right now before paying for the surgery, $40,000 to date for what I paid for medical care in Canada. Not to mention what I've lost in wages or what I've lost in
punitive, damages, I guess they say.
My quality of life, right? Like the rest of it can go out the window. Thankfully, I have an extraordinary team that I am leaning heavily on with my clinic that, it's doing its thing. So if you ask me if I've had to travel,
tremendously.
Oh, I've been to like the Alberta Balance Center to determine if it was like a vestibular related issue. So if it's like my ears, if it's like Meniere's disease, he's like, nope, it's not central nervous system, or I'm sorry, it's not peripheral nervous system, Michelle, it's central nervous system. So that's when I was like, okay, it's central nervous system is the issue. And then I left there, and then I came home, and I was like, what the hell? Like, now what, And so I took that beta blocker that they told me, and it was like,
what is a beta blocker?
So a beta blocker is a calcium channel blocker, and what it does is it helps to regulate your heartbeat.
Oh, okay.
So because my heartbeat was so erratic and my head was so bad, it seemed like the most logical course of action. But essentially what I realized had happened is that because of the inflammatory response and because of the spike protein response from my body, my blood started clotting.
Yes.
And so my blood was clotting, and as a result of that happening, the viscosity was slow, and so because that happened, my blood vessels started closing. And so when they put me on the beta blocker, they basically were stopping the pump, but the pump is fine, but the tubes are blocked. So I had thick, viscous blood trying to push through tubes that were closing and a pump that they stopped because of the heart.
Wow.
So I almost died.
My goodness.
Like I literally almost died. And so I have not worked a day since. So that led me to Balance Center, Heart Clinic in Alberta, which determined that my blood vessel system is damaged, that my vascular system is 69 years old. I'm 44.
Wow.
And I said to my mom at the tail end of like 22, I feel like I've aged like 2 decades. I was like, I feel like I am trapped inside like an 80-year-old person's body. And I just am like, what the is happening?
Yeah.
My vascular system's 69 years old. So I bring all that information to Canada, to Fort St. John. Oh, that's not accurate. They don't know what they're talking about.
How could they dismiss that?
I was like
what grounds in Fort St. John are they be able to make that kind of statement?
So I paid $4,000 at a Heart Fit clinic in Edmonton, which is the equivalent of the Mayo Clinic in the U.S. in Cleveland, Ohio. $600 for the auditory balance clinic. Naturopathic medicine, IV therapy. I did IV therapy to thin my blood for like, I don't even know how many weeks. My blood pressure and my heart rate, like my blood pressure at one point was like 147 over 126. And then it was 47 over 30, which you should be dead. And I was in the hospital and my girlfriend was with me, and like I sat up and my heart went crazy, and she looked at the monitor and she's like, oh my God. So she called the doctor and he came in and he was like, oh my God. He's like, this isn't migraines. He's like, this isn't migraines. I'm not sure what is going on with you, but this is not migraines. And I was like, thank you.
Yeah, somebody.
So he was the second person that said POTS. He's like, I don't know why though. I don't know why, but this isn't just a migraine. Like you have a headache, but something's wrong with the rest of your body. And I don't know, tenacity, frustration, anger, knowing that I have a really good life. Like, man, I have a good life. But I was like, this is not it for me, you know.
The fight, eh?
Oh, like, just to be honest. And so then that's
It's
just
draining.
Oh, it's draining. And so so I left British Columbia. I went to Alberta and I pieced things together, and I came home and I took a bit of that, and I found Patel myself, and I talked to my family doctor in Calgary.
Patel is the doctor in the States?
Yeah, neurosurgeon.
The neurosurgeon in the
Yeah.
States. So that's what led you to him.
Was me. I literally like found his article, did the research. I was like, I wonder if he's still practicing.
So you reached out.
So I phoned MUSC, Medical University, South Carolina. I was like, does Dr. Sunil Patel work here? And she's like, yeah. I was like, is he taking new patients? She's like, yeah. Canada? Sure. She's like, people come from all over the world to see him. I was like, then I want an appointment. And she's like, okay. So that was August.
And so, so
I
that
found-
happened pretty quick.
Yeah.
What's going on?
Yeah.
So
Yeah.
he, how did that look? Did you have to go to see him, or was it
yeah.
So you flew down to?
So everything again goes through like my Alberta physician, like him. And so I was like, what do you think about this cyst? And he's like, I don't know, Michelle, like, I don't know enough about it. But he's articulate enough to say, I'm not sure. It's unusual. It's unprecedented, but figure it out. You know, like, I can't help you there. It's the US, but I'm not sure. Figure it out. He wasn't like, you're an idiot, you know? And so I was doing the IV therapy. My heart rate regulated a little bit. My blood pressure came down. And so if you look at, so I got this spike protein supplement somewhere in like February that I started taking. And Rollo therapy or Rollo formation is like, it's a clinical formation of like blood presentation. So it's somewhere where like, why it happens, hard to say. There's a variety of reasons, but essentially you have, so if you do blood work, you'll have the right amount of red blood cells. So your red blood cell count will come back as like what it should be. But Rollo formation is when your blood sticks together. So say like 8 RBCs, like 8 red blood cells stacked, so they have the surface area of 1, right? So if you think about red blood cells, they facilitate oxygen exchange.
Yep.
So now instead of having 8 that are stretched out to do oxygen exchange, they're stacked together, so they only have the surface area of 1. So you might have the right amount of red blood cells, but you might not have them
The orientation
Correct,
of the red
yeah.
blood cells.
So in January, I had gone, so Brooklyn Wilms, she's fantastic. If you ever have a chance to see her, she's here. She is mentoring with a gentleman out of Alberta. It's funny to me that these like unorthodox practitioners that look outside the box are from Alberta. He's Red Deer. I've talked to another guy in Sullivan Lake. My doctor's in Langdon, heart clinics in Edmonton, you know. And so I saw her in January. And so when I went, this is like this year. So she did a live blood analysis on me. And when you go in to see her, she doesn't say anything. You don't tell her what's wrong with you. She takes the blood, she does an analysis, she looks at it. And if you looked at the pictures of my blood presentation, it looks like Rollo therapy. Not Rollo therapy, Rollo formation. I was like, weird. What the hell is that? So I started trying to figure out like what that is. And I was like, okay, well, if I'm having an issue with oxygen exchange, if my heart rate and whatnot is not working properly, if my blood is thicker and my RBCs are stacking, well, then it would make sense that the blood is thick and it's not doing what it's supposed to do. And so I started this IV therapy that's specific for blood coagulation. And I started doing that. And that dropped my heart rate and it helped with my blood pressure. And so I said to my partner, Dave, I don't know if I should go to Charleston. Like, it's expensive. You know, I have to pay to get there. The flights are expensive. I'm kind of starting to feel a little bit better. Like my mobility, I was standing. So basically from the time I went on the beta blocker, I did not walk for 4 weeks.
Wow.
I was in the dark for 4 weeks. I had no blood pressure in my leg that I could stand on my own. I couldn't walk, Kevin. Like, I literally could not walk. I spent 4 weeks in the dark with an ice pack on my head and my kids in and out of my room, in and
You
out of...
just didn't have the oxygen to your body because they've slowed your heart.
Everything stopped. And I still didn't know why. I just was just like, I'm fucking dying. Sorry. I was just like, I'm dying and I have no idea what's wrong with me. I was like, I don't know. And so I was just like, I rewrote my will. I like lined up my life. I like thought about calling my children to say bye. Like, I was just like, oh my goodness, like, what is happening right now? And they saw it all. Like, they saw me like in and out of emergency. They saw me like, they saw everything. Like, for what? Kids, like, they should just not have to witness anything like that ever. And, whew.
It's understandable. I mean,
It's wild. So yeah, so anyways, I was just like, I can't go, it's too expensive. And I kind of gained a bit of traction. But my memory was going. Like, my vision was getting worse. My memory was going. I was like, and so Dave's like, Michelle, go. Just go. It's going to be expensive, but go. I was like, okay. So I took all my imaging from Canada and I flew across the country, the continent, to South Carolina. You know, it cost me $6,000 to go see him because he wants to see you in person. Weird, huh?
yeah.
Weird.
The opposite.
Weird that they want to see you in person. And so I sat down and he talked to me and I brought all my stuff because I wanted to like read what was going wrong because I can't remember it, you know? And he's like, tell me. And I didn't know what he was doing. You know, I had my sunglasses on. And so I was trying to like, and he asked me again and I tried to figure out how to tell him. And he's like, okay. And he looks at my MRIs and he's like, sorry, I'm quiet. And he's like just like, whew, when he like walked in the room, like, it was just like, I don't know. I don't know what to say.
There's something there that just let you know that you were with the right person.
Mm-hmm. And I went to just find an answer. I went to find out if I just needed to be patient and I just needed time, you know, if I needed to be more patient with myself. I went to find out if it is part of the problem and we need to address it, you know? And so he looked at me and the onset and like the acuteness of the symptoms like collecting. Cause again, it's like, these are the symptoms. This is how fast it escalates. And he stopped and he came like wheeled over and he's like, so the access point is here. And I was like, ugh. So you're saying I need the surgery.
So this was a surgery that was already on the table?
Yeah, right away.
And he was doing an evaluation as to whether or not it was something that was needed?
He was the one that looked at my MRIs from Canada, met me, listened to me, my symptoms, observed my presentation in front of him, my difficulty word finding, replacing words, slow process, ocular sensitivity, and looked at the imaging from Canada. And then
also conversations with your doctor. What doctor in Calgary was that?
No conversations with my doctor in Calgary. No,
So this was directly from you?
This is from me. Yeah.
Oh, okay.
Yeah. So, MRIs are from like
No, but
Canada.
the information and like the presentation.
Yeah.
Okay.
Everything from me. Yeah. Which is how it is because that's what he said. He's like, someone asked me this, like, I can't imagine people walking into his clinic and leaving and him telling them that you need brain surgery. Like, they can't walk in there. They can't walk in there. And I was like, they do walk in there because they're like tenacious like me. They're tenacious like me because the hardest part of it is like, yeah, so anyways, he looked at that and he's like, yes, in my experience with my removal of over 200 symptomatic pineal gland cysts and the recovery of the patients, 95% success rate of the surgery of individuals, 90% success rate of like the rehabilitation of symptoms. And I was like, okay. And so we finished up our conversation. Obviously, we talked about funding. We talked about how much we were going to come up with a financial plan. I needed to digest this information, figure out if was what I was going to do, you know, come home, talk to my family. And then he left and then I went to the front and we started consecutively booking appointments. And I was like, okay, we'll book them. I'll go back. I'll figure out funding in Canada. I need an estimate from you guys. I don't know what it's going to cost. And she started talking to me a little bit more, the administrator, and I was like, oh God, I need to talk to somebody again. And so I talked to his physician's assistant, Jared, who's really great. And I was like, okay, can you like walk me from start to finish what this looks like?
Yeah.
He's like, for sure. And he's like, so you know the feeling that you have every day. And like, he didn't even need to start talking about it because like, unless you feel it, you can't explain it. But I have this support group, like a pineal cyst and tumor support group on Facebook now. And my goodness, I don't know how the heck I didn't find them beforehand, but like when they wake up from the surgery, Kevin, like it is gone, like gone.
That feeling.
Like one
like
lady
when
was,
you know something's wrong.
the one lady that I just talked to, so she had surgery on the 27th of October. I'm speaking to her now. She leaves Charleston the 9th, so her and I will miss each other. And she went from like me to clinically blind.
Wow.
And she woke up and she could see.
What does this surgery look like? You started talking about where they need to release pressure and drain some fluid from the base of your...
So they'll do a spinal tap. So it's like an epidural. So if women that are having C-sections, they'll do like a needle like in your lower spine. And so that for the frees your lower back, right?
And isn't that needle huge? Like down near a foot long? I'm
going to be sleeping. I'll be sleeping, so I'm good. No, I've had an epidural before, not from having babies, but yeah. So anyways, so they'll do a spinal tap. So I'll be sedated. I'll go under. They'll do a spinal tap. They'll drain cerebral fluid so that your brain.
And that's with that hole that they drill into the base of your skull.
The spinal tap will be the base of your skull or your spine.
Yeah.
And then they'll drill into the back of your head. So they'll do like an MRI. So they'll check. So there's like it's called vein of Galen, I think is what it's called. So that's like the anatomy that runs like really, really close to the pineal gland. So they need to make sure that they can identify where that vein is, because that is like essential for the vascular flow to your brain. So part of like having a symptomatic cyst is, for whatever reason, there's hormonal imbalances, like chemistry imbalances in that cyst, and that's causing like snowball effect to other areas. Also, like the pineal gland isn't big. Like it's like 0.6 to 0.8 millimeters. Like it's small. So when you think about what that stupid thing does, my name's Floyd. I named him.
Oh, you named it?
I named him. His name's Floyd.
How did you come up with Floyd?
So I have a friend of mine, and her and I were talking, and I was talking about like visualization, and I said something about a diamond, and she said, you know how diamonds form? And I said, yeah. And she said, under pressure. So we came to like how much pressure I have. And she said, but you know that like the value in a diamond, like given the pressure that it's under. And I was like, that's super awesome metaphorically, right?
Yeah.
She said, but the process, which is funny that I didn't know that, because like I'm a registered dental hygienist, dental hygiene practitioner. But before hygiene, I worked in mining for 5 years. So I have a chemical engineering technology diploma as well. So it's funny that I didn't even think about diamond mining. But Floyd formation is how is a process of diamond formation. So that's where Floyd came from. So the cyst name is Floyd. Yeah, so they drain the fluid, keyhole access in the back of the skull to make it easy. Essentially, a straw goes in through that area. Endoscopic goes in through that straw. They go into the center of your brain, take that whole thing out. So the cyst is the same size of the gland. The likelihood, similar to like you imagine a mastectomy, right? Like if you have like mutated tissue, you can just take the tissue, or you take the breast because it's better to take the breast. It's similar for this cyst. So instead of like trying to do what they call, and they'll do it, fenestration, where they drain it, their approach is they take the whole thing, because it's less likelihood of like repeated mutation of cells. Because if you're predisposed to have those cells mutate from exposure, then they would rather not have to deal with that.
So the access is relatively invasive as far as it's through that hole.
Yeah.
And then they're able to use obviously different tools and whatnot to be able to get and remove this cyst.
Yeah.
So,
Yeah.
but it's in this, now when you say it's in the center of your brain,
It's in the most center part of your brain. Like it's in the very middle of your brain. So it's very, very high. It's very high risk.
yeah. So exactly. So
Yeah.
what are some of the risk factors?
You die.
Yeah, okay, well yeah. Silly question, I suppose, eh?
But you know
Yeah.
what though? I what are you going to do, right? Like, so here's the thing. This is the difficult part. Aneurysm, hemorrhage, death, brain bleed. One lady I talked to, her blood pressure dropped, and I just talked to her. Her blood pressure dropped. She had 2 strokes. This is after the surgery. Ended up back in the hospital. Stabilized her. No damage from the strokes. This woman said she would still do the surgery again.
Wow.
There's no dismissing there's risk. Of course there's risk.
Yeah.
But what they offered me,
The alternative is worse.
well, what they offered me was a trial drug for injections for ACGP antibodies, which incidentally, which is this like lunatic of a neurologist that I just talked to in Burnaby.
Oh, wait a minute. Is that Dr.
Toth.
Oh, you told me about him, and I looked into him a little bit.
I don't even know.
That is some pretty bad feedback that he seems to be getting.
He gave me the recommendation for this like trial drug for migraine management. He didn't even look at my MRIs. He didn't even have my MRIs. That was a second neurologist in Canada that I talked to. That referral was sent to him in December of 2023. I talked to him October 4th of 2023. My partner called in on the phone call so that we could both be on it together. And he started off with, how are your headaches? I was like, I was like, well, it's not a headache. And, what are you doing? And I was like, well, so I started taking tramadol. August, it got like way worse. Was August is where I like really started going downhill. Like it's been downhill, but August is like accelerated quick. Flying is horrible. Man, flying is painful for me. It's not good in the slightest. There's so much pressure. So I ended up in emergency again, like in August. And so it was like hydromorph, some weird steroid, like all these things. And they're like, what do you have? I'm like, I have sumatriptan, but these aren't migraines. So I'm not taking the sumatriptan. So they gave me tramadol. So like up until like 10 days ago, it was like THC, CBD, and tramadol, the earlier of the two, to help control nausea because I dry heave most of the time. Eating is very hard. So it's interesting when you talked about like fasting and digestion and whatnot, like it's really hard for me after I eat because like circulatory wise, like everything goes to digestion. So like my level of nausea is super high. Plus there's so much pressure in my brain. So it's like, I'm always nauseous. And so, yeah, we talked to this neurologist and he recommended these trial drugs. And I said, 9 months, trial injections, need to apply for it. Take about 4 to 6 weeks for us to hear back. What does that do to fix the problem? Nothing. It manages symptoms. Well, what are the side effects? Nothing that we're aware of. Okay. And he said, well, when did this start? And I said, it started after my second COVID vaccine. And now my partner's on the phone, which I'm super grateful. And he said, there's research showing, and I have patients that I'm seeing that have, they call it central sensitization syndrome, which is a chemical change from the vaccine that causes people to have heightened sense of pain. There's no reversing it. He said that. I said, well, how do you reverse that? How do you reverse the chemical changes that you just said?
Is this Dr. Toth?
This is Dr. Toth.
Okay.
He didn't write that down on paper, though. But he said it to my partner and I.
So he's trying to discredit what you're experiencing.
Completely. And I was just
isn't
like...
he from Alberta? And for whatever reason, I'm not sure what's going on because there was some talk on this, a little bit of research, but it definitely alluded to where he was kind of kicked out of Alberta. Yeah. Now he's in BC.
Yeah, Fraser Health. Working at Fraser Health.
And his demeanor, I guess, is unbelievable.
As soon as I mentioned, so he told me his treatment recommendations. And we talked about how the onset, and he just said we can't fix the whatever has been done to your system, but we manage symptoms is what he said. And I said, to be exact, you're not sticking another fucking needle in my body. And my partner was like, And he said to me, well, it sounds like you don't need help or you don't want help. And I said, this is not about that. I said, I did that once. I'm not doing that again. And I said, I don't want a Band-Aid. I want a solution. And my partner, thank God, I love Dave. He's like, maybe you could explain it to us, Michelle, like, let's just explain it to us. And so he explained, he didn't say what it couldn't do or would do or whatnot. It was just managing symptoms. And so then I said, well, what about this pineal gland cyst or this like lesion on my parietal lobe? And he's like, no, absolutely not. And I was like, absolutely not. I was like, well, like, what about my MRIs? He's like, oh, I don't have those. I was like, you don't have my MRIs? He's like, I haven't looked at them. He's like, oh, I can go on like Healthy Link and I can pull up your chart and I can look at them. So he didn't even look.
So these recommendations that were trial for however long to maybe manage symptoms were based off of just, I guess.
I have a migraine, they say, and so now instead of me overusing prescription painkillers, let's do gene peptide antibody injections instead to combat the pain that you're feeling from your headache. Not
and
any
then deal
not
with
any,
whatever symptoms are an outcome of that.
Yeah. So I talked to him about it. We realized real quick that he had never looked at my MRIs, that he gave me a treatment plan without a clear, definitive, comprehensive history. He didn't ask about my baseline. He didn't ask about anything. And that was that. And he said, it doesn't sound like you want my help. And so he hung up and Dave and I sat on the phone for a second and I was like, I am right. He's like, oh my goodness, Michelle. Like he just said that out loud. I was like, I am so happy you're on the phone with me. So I'm not saying that Dr. Patel says this. I'm not saying that. Right off the record, Dr. Patel does not say symptomatic cysts are from the COVID vaccine. What he's looking at is what is wrong with the tissue changes in a symptomatic pineal gland, and now what is wrong with the chemistry of the cyst. So if it's tissue would determine tumor, malignancy, or a benign tissue, right? Chemistry is the fluid is the cyst. So that's what he's looking at. So what is now different if they do remove, or when they do remove it? If it is a tumor, what does the tissue look like? Because there's there's a handful of types of cells that are in a pineal cyst. There should be more prevalent pineocytes. It should be more of that than something else, but maybe it's not. But if it's the cyst and it's not a tumor, then they'll look at the chemistry. It seems curious to me that this neurologist says the vaccine changes chemistry in your body.
Exactly.
And Dr. Patel is like, well, why is there chemistry changes in a cyst? He, again, very, very clear. Dr. Patel is not saying this.
No, but he's taking it from an approach where the cyst and the surgery, what it's going to accomplish is not only relieving some of the symptoms and things that you're dealing with right now, but that they can end up using it as a sense of direction to be able to figure out what caused it and then have a better understanding of the root cause. So we know basically the root cause is from this, what was that again with your system, neurological...
Like inflammatory response?
Inflammatory response. But then how is that having an effect on your body when it's, now that it's producing cysts?
Yeah. That's
not only within your brain, but then
multiple organs.
So what's the time sensitivity on this major surgery versus maybe taking a cyst from somewhere else to have a better understanding and maybe prolong this major surgery?
Yeah.
And then maybe have reduce the symptoms and solve that, maybe a different approach.
Yeah. We have, I don't know how you can just say when you know, whatever
this is the right route, though.
I know. Yeah. I know. There has been, there's a path that has been I didn't find him by accident. I didn't connect dots and when you talked about the doors open to we've looked at everything of in a systematic approach and a logistic approach and a research-based approach. And I don't know what cellular changes there are in these areas of my body. But if I can look at the associated success of people that have this type of cyst in particular and the corresponding neurological symptoms associated, what my hope is that it will give me a fighting chance to rehabilitate. So remove a cyst that outside of the causation of that mutation. Nonetheless, when it's a diseased area of your body, it is not able to regulate other areas of your body. So in my approach, I think there's success in this. We know it's symptomatic. Let's remove it. And then you don't have a diseased area that regulates your endocrine system. In theory, if your endocrine system can regulate, the hormone changes will regulate. Maybe I won't have breast cysts anymore. Maybe my liver and neurological system and circulatory system can start functioning properly. Like when you think about what your liver does, like your liver filters your blood, right?
Yeah.
Like if your liver's trying to filter blood that can't filter so well through there, it's going to create inflammation. Inflammation is the root cause of disease. Inflammation of anything like cellulitis, sinusitis, there's like inflammation. So itis is inflammation of anything. Unfortunately, if you have inflammation, then you have disease. Unfortunately, that system in my body is I don't want to say it's beyond repair, but what I've done to try to repair it, I've done the very best I can. And I absolutely have faith in him. And I have faith in the process of how I've gotten here. And I have faith that when that part's removed, the inflammatory response in my body can just settle down.
For sure. Yeah, I think it's a good choice. I mean, you're taking the most hazardous part out of the equation, which buys you the ability to have a little bit more mobility and freedom.
Yeah.
And then also maybe get a little bit of a better understanding of the next best approach.
Yeah. I can continue to try to do all of the things that I'm trying to do. But that's a real missing, that's a piece. And the difficult part of it too is Dr. Toth's it's just funny what he decided was appropriate to write in my clinical notes and what he thought was inappropriate. He did not have any mention of this vaccine related chemistry change. He spoke to the diagnosis of a symptomatic pineal gland cyst being insanely incorrect. I'm not really sure at what point a professional neurologist's language would include that, speaking yet of another very highly recommended expert in this field, right? So it's interesting to me. But if we can look at so many other things, and if you can look at, other ways that we're impaired with disease, and you look at research and you look at science and you look at literature, we have so much difference of opinion across the border. Mm-hmm. If you look south of the border, it's there are more than just him as a neurosurgeon in the U.S. that's done the surgeries. There's surgeons in Germany and Australia and
following the science in Canada and the States and Germany and everything else seem to be wildly different.
It's completely different. And I've even provided them here with literature from a research paper in Calgary from University of Calgary 2016 that talks about symptomatic pineal gland cysts. Yeah, they're rare. Yeah, we don't know the exact reason why the tissues do what they do, but it doesn't mean that it's insanely incorrect, and that you wouldn't even consider that as a viable option. And don't get me wrong, it is super risky. It's risky.
No, for sure.
It's brain surgery in the center of your brain. It's pretty darn risky, right?
There's no way. Absolutely. There's no way around it. Even with the current technology and approaches, it probably has taken a lot of the risk out and probably made this even more possible than even before. But you're still dealing with that. At the end of the day, you're dealing with a very high risk surgery. Have you, so I wanted to know in your process here, I was curious about the letter that you sent to Dan Davies September 18th, which he then sent a letter to Minister Adrian Dix October 10th. And that was, I guess, in regards to informing him a little bit about your situation and maybe if there was the possibility of having provincial financial support. Mm-hmm. Has anything come of that? Zero. Has there been any response from Dan Davies' office?
Dan's been fantastic. Dan's on my phone. He texts me. He gives me updates. You know, he was in Victoria the last few weeks. Adrian Dix is avoiding him like the plague.
Yeah.
He doesn't want to talk to him about it. You know, there is interest in from a local government level of external audit into Northern Health. I'm not the first person that's come to Dan with similar situations where there's been like lacking reporting, you know, like the fact that this pineal gland cyst was not written down properly on my radiological report. Like why they found it in August of 2022 and I didn't find out till January 2023. And, you know, I'm going to come home from South Carolina and I'm going to be better than ever. And I'm going to be 6 months post recovery and kicking ass. And, you know, what seemed to be really insignificant to write down for like documentation. And so Dan's like, what is going on here?
Yeah, there's a lot of stories surfacing that I'd like to even try and cover the best I can when it comes to stuff like that, because the amount of people that are being impacted negatively. There's another, there's a BC man that is dealing with the same exact situation as you, where he's liquidating everything for an American surgery. Yeah. There's, my wife just told me about this Lucy Holland who ended up passing away because she'd go in looking for help and the symptoms were disregarded, and the result was where she ended up passing away.
Yeah, well, the amount
here in
of people...
Fort St. John, there's, I mean, I don't want to throw names out of respect to those people, but there's, and if you're local, you know, I think everybody seems to know someone that is adversely affected in a negative way or losing their lives because of a lack of, the address to serious symptoms.
They're just not listening.
No.
Like there's people just aren't listening. They're being dismissed. And I'm not joking when I say 1 in 1 people have mental health issues, and I'm not I'm not making light of that. It's not funny at all, because people do have serious mental health issues. But like there's like physiologically on a cellular level, people are not well. And to just ignore them and just say that they're overly anxious and stressed out and you've been, you know, in your house for too long because of COVID and that's what's wrong, like you're wrong. Like you as a medical professional, you're wrong. Like you're not listening to your patients, you know? And like I am like genuinely like the first person to be there to help people and listen. And I mean, I wouldn't be in healthcare if I wasn't. And you know, the amount of people since I've kind of started coming out and talking about it, it's taken me almost 2 years to talk about it. And partially that's because, you know, I'm a regulated healthcare professional and I take that very seriously. You know, I've served as a board of directors on my what was existing college board. I've worked on inquiry committees, like, you know, and there's a credibility piece that's huge, but I also feel like that credibility piece puts me in a position where like I am credible. So like what I have to say, if I'm going to say it, it's actually true and it's going to matter, you know, and like I'm not blowing smoke here, you know.
It must have taken you a while to get to that point where you wanted to be able to just be as vocal as you are right now.
Well, you know what did? Having to pay $147,000 for brain surgery in the US, selling my holiday trailer and my vehicle, leveraging my business that I built and borrowing everything I can. Fort St. John, you know, a crowd fundraising. They raised almost $73,000 in 34 days,
I wanted
Kevin.
to touch on that. That was a GoFundMe in Fort St. John. It's
not even the GoFundMe. There's a lot of issues with the GoFundMe because they take a certain percentage, and I think after the truckers rally, they didn't really clearly say where the money was going, so people are a little bit concerned. So most people have reached out and said, "Can I have your email?" People are sending money. You know, I've had people, you know, some people have paid for our flights to Charleston. Some have done like the community. I don't even know, to be honest, like how many businesses donated to this like most recent like auction that they did. The fire hall donated $10,000. Like, and so on last week, we were coming closer. I needed to pay by yesterday. If I didn't pay by yesterday, the surgery is moved till the 20th, or I'm sorry, not the 20th, till like January. to give me time to save more money. And somewhere just before the GoFundMe started, I was still just like, I don't know. Like, it's brain surgery. And I lost my sight.
Wow.
In my right eye. And I was like, you have got to be kidding me. Like, I was like, okay, my sight is going. I'm in pain all the time. My short-term memory's going. I'm not dying. But my family, like, I'm not going anywhere. Like, my heart is strong. I'm not going to be blind, in pain, and not remember my family for like 40 more years.
Yeah.
You know, so I'm just like, I am choosing this because I refuse. Like, I have a living will, and I'm sorry if I'm a vegetable, I'm not around. Like, that's not who I am.
The quality of life.
No. So this is totally quality of life. And so I got the estimate first week of September, kind of puked in my mouth a little bit. I was like, oh my God, it's $107,000, $4,000 US. Oh, gotta be paid in full. I was like, a payment plan. Like, can I get like WestJet dollars, you know? Come on, cut me some slack. And they're like, no, it has to be paid in full. And I was like, holy smokes. And then when I lost my sight, I was like, that's it. I don't care. I'm going for it. And I came home and I talked to my kids. And my daughter was just like, you know, Mom, is it surgery? And I was like, babe, I'm not sure. It's okay. I'm not sure, but maybe. But we'll look at everything else first, honey. And as as I'm getting worse, it's just I'm not doing this. And so I sat my kids down, and how's that for a conversation?
Tough one.
Yeah.
Must have been having that kind of roll around in your head for a while before you committed to that.
Well, and like, like they've what they've seen in the last like 8 months, because like since February it's been like super radical, and like Paige is just like, yeah, no, Mom, I just want like you back, like healthy and happy like you were before. And so they've seen me cry, and I'm not like, you can't hold stuff like this in from your kids. And I think it's super important that they know that they see me like this. But by the time I've come to terms with like what I'm going to be doing, I've already gone through like so many feelings. And so it doesn't mean that I don't get like upset from time to time, because it's a reality. But like part of it too is like, I need to be strong for my kids. And like, I believe this is the answer. Like, I'm not afraid. I don't like it. I'm nervous. I mean, who wouldn't be? But like, I'm not afraid of this surgery. I'm afraid of trial and drugs.
Yeah.
I'm afraid of like what next year might look like if I don't do this right now.
And the possibility of being able to get ahead of it instead of trying to manage how to manage it, and then also the unknowns of what the outcome of those symptoms are going to be. And that's a vicious cycle. I mean, talk to any person who's a diabetic.
Yeah.
They're going to give you a whole pile of stuff, and then a whole pile of stuff on top of that to manage the side effects. And then that's normal and everything else. Whereas if you are able to manage the root cause of absolutely anything, you don't have to deal with all of that extra stuff. That's all about trying to manage the root cause.
Yeah. And that's really it. Like, just to get down to the foundation of like what that is. And this is the answer. And this is going to give me an opportunity to fully rehabilitate, like an opportunity for my body to just like, and then I'll move forward,
One of the things that I would like to touch on too, and then we should start wrapping it up a little bit here.
Yeah,
but,
of course. We said that we could talk for a really long time.
Oh man, this could go into forever. But there's a pretty negative disposition towards mainstream media, and a lot of it's justified, and maybe a lot of it's just misled. But at the end of the day, there's been a couple of articles that touched on you, and CJDC is one of them, where they I think probably highlighted a few things that normally previously would have never been touched on. I think another news article was by Energetic City News.
That's right.
What was your experience with that, and do you feel they were accurate? Like, I know one of the things that popped out with CJDC specifically is that they actually worded, where is it now? I'm gonna bring it up, because the wording of it was for St. John woman suffering from rare brain condition after COVID vaccine shot. When
Yeah.
has any mainstream media
No, that's
worded anything like that? So
Yeah.
was there, what was their report like, that interview? Was it something that was accurate?
It was, and she talked to me about us being able to get together, and I just mentioned that I wasn't really, like, it's really difficult like this. Like I talked to you when we drove out here, that I'm like saving all my energy right now for surgery, and like I'm not a germaphobe person, but like right now we're really like tightening up our social circle, like our little circle, because I don't want to end up with a cold or something stupid.
Yeah.
Just so I can go.
That's a good
right.
call.
Yeah. So it's important. Outside of that, it is very difficult for me to manage in situations that are like overlit or overstimulated. So I don't really leave home a whole heck of a lot. So she came to me, and it was really important that she captured the truth. And that's all I wanted. And so I wasn't interested in talking to someone that was going to like, cut and paste and like have it tailored to the message that they were talking about. I wanted it to be the right message. And I wanted it to be understood that like this onset, in my experience, was from my second COVID vaccine. This is a series of events that has happened. These are the systems in my body. This is the presentation of a body that had no evidence of disease. And the last piece of the puzzle is this symptomatic brain cyst. And these cysts are around. There is a very small percentage of the population that have them. Even smaller than that is the percentage of those people that it's symptomatic. Why it's symptomatic, it's hard to say, but the understanding behind them is that there is a chemical change within that cyst that causes it to be symptomatic and diseased. Coincidentally, the vaccine does the same thing. So there is a collection of information, and I needed that to be delivered properly.
Yeah.
She knocked it out of the park. Like I was super happy with, like, there's nothing misleading. Like she did write a few things that kind of like interpreted like my discussion of like Dr. Patel's research with the corresponding statement from the neurologist in Canada. And I really needed to make sure that she didn't communicate those two being associated, because that is not the case. The research is developing, so maybe it is the case, but we don't know that right now. All I know is that I was vaccinated. My life has been a living hell ever since. And incidentally, I have a symptomatic brain cyst, and I'm going for surgery to have it removed.
Was the reporter's name
Saprit
Sahata?
Yes.
Well, shout out to Repeat.
Yeah, she was wonderful. Like she was like wonderful. And then Shay from Energetic City, she's reached out a couple times, and so she did a few articles. There was a period of time that I just kind of like said, no, I can't really, I don't have space to talk about stuff. I'm tired. You're welcome to like look at the information that's on the GoFundMe. It's accurate. I sent the same letter that I sent to Dan Davies. I sent to Energetic City, and I sent to like a bunch of large networks. And funny enough, not one single one of those large networks, Global, CBC, Vancouver, Edmonton.
Oh, really?
No,
they didn't report on
zero,
any of it.
Zero.
Well, that doesn't necessarily surprise me.
Yeah, and I sent my letter. I sent my estimate from MUSC. I sent Dr. Patel's letter. And I sent like that last caption that I sent you, where like the neurologist, the MS neurologist here talked about me directly asking her about like onset of neurological symptoms post-COVID vaccine. You can ask me anything you want. I will give you the information. I'll give it to you. So we're third stages now, the vaccine injury program in Canada. They have my health records are a wide open book. They've connected with every single medical professional that I have worked with since November of 2021. And I'm in the third stages. Don't know what that means. There's a very clear disclaimer that there is no if it gets approved and if they accept it, there's no accountability. I forget how they worded it. Essentially, that there's no ownership in the causation of this. It's just a recognition of like a reported
liability issue.
Correct.
They're just trying to make sure that they're going to be protected from being sued.
Right. So it could be like a documented adverse reaction or adverse effect, but it doesn't mean it's anything else.
Well, you're registered with Vaccine Canada something, aren't you?
That's the vaccine injury program in Canada.
Okay.
Yeah, so that's the third stages. So
okay.
And so throughout this.
So is there funding through that for support too, or is that just a registry where they can now develop a little bit of a database?
Yeah, so essentially that. So like I have my doctor in Calgary is saying and seeing there is a direct relationship with the COVID vaccine and the onset of my symptoms. This is the process. This is where I am. This is what I have. So we sent those in. It goes through an initial preliminary. Stage 1, is there associated causation? Yes, there is. Stage 2, is there extenuating disability associated with that causation? Yes. Step 3, what is the degree of which? Now we have a medical panel that's now reviewing my case. This was submitted in April. I've had 3 case managers since April. So I just keep getting like bumped from like
it's just that vicious cycle.
Case manager to case manager.
Why is that that's the cycle no matter where you go?
Well, because you know what it is because if they interrupt it and make it difficult enough, they think you'll stop.
Yeah.
They met the wrong person. They met the wrong person, because I am like, no, like this, what is happening now is wrong.
You have a quote that I noticed on a lot of the stuff that you sent me, and I'm going to read it here, and I'd like to actually ask a little bit more about it, but the quote that you seem to have on a lot of your emails, and even some of the documents you said, or you sent, a ship in the harbor is safe, but that's not what ships are built for, by John A. Shedd, American author. So that sounds like you're the ship and you're not designed to be in a harbor.
No, and the other quote is by Seneca. Man, it's hard sometimes.
Comes in waves, doesn't it?
It does come in waves, because like there is power in language. There's power in words. Like there's power when you can like speak truth, right? Especially when you haven't spoken it for so long. And thank you. And Seneca says, oh gosh, I'm going to butcher it now. No wind is favorable. No wind is favorable if he know not which way his sails aim. I totally butchered that, but essentially
I'll
it's
look
like,
it up.
yeah,
Right.
it doesn't matter. It doesn't matter if you have the sails. If you don't know what direction you're going, like the wind is not going to be favorable for you. And I know all that, and it doesn't matter if a wind is favorable or not. I'm going to use the wind because I'm ready. And it's true. Like, it's been a collection of information. I know who I am. Are you hoping that this story is going to maybe be the catalyst to a lot of other people being able to come forward and maybe actually tell their stories and bring some awareness enough to where it's going to bump the needle to where people who need the help that are injured with a vaccine or indifferent are actually going to get the help that they need? Yes. In multiple ways. Like, this isn't like our system's broken. Like, our medical system is so broken. And so if it is the vaccine and somebody else is vaccine injured and this helps you, that's amazing. If it's just looking at, not just, because that's huge, that's huge. Vaccine injury, COVID shot injury exists, and don't ignore people, because like there's truth there. Our medical system is broken, and I don't know what is going on, but there is a cover up, and like people are not being heard. Pharma is being pushed, and people are being ignored. Science isn't being followed. I don't care what anybody says. There's no evolution of the data that we have. We're stuck deep. Our heels are just, you're gritty, and there's no room for questioning that. And then you get people that, they're lost. And so since kind of like starting to talk about it, and if you want to know why I started talking about it, it was literally because I need frickin' money to go for brain surgery. Like it put me to the place where like my back is up against the wall, and I am like, people need to know about this. Like, people need to know. People need to know that we can't get medical care in Canada. People need to know that you're ignored in Canada. People need to know they push this vaccine on everybody, and now you have sick people. So you are super willing to protect the public and promote safety and health but where are you now? You know, like I've tried to, talk to my family doctor about like what other recommendations she has for me. And in the meantime, we've had all these GPs and family doctors like pushing the vaccine. And I'm sorry, you were misled. You were misled. I feel for even like our medical professionals that were misled, that had to push this, new developing vaccine, and, but I don't know if they can admit that they were wrong, and maybe they can, but they just can't because they feel morally injured too. I don't know.
We were talking earlier about that threshold and that line that's crossed and the shame and a lot of things that go with that. And I think it's another attribute to what you were talking about originally at the beginning with, what was that? The moral injury.
Yeah.
There's a lot to be said about that. And what you're doing is similar to a lot of the people that felt alone a little bit and disconnected, and like nobody else, there was no support system and nobody else felt the way they did during COVID.
Yeah.
And then that's why the convoy, I think, took off the way it did, was because all of a sudden it just showed that there was a whole lot of other people that felt the same. Now on the back end of all of this, with a lot of vaccine injuries and the remnants of safe and effective has continued on, and people are still really concerned about their careers.
Yes.
None of that stuff has gone away.
No.
And so you're dealing with a lot of the same things, which is no joke. Anybody who went through COVID, now there's a lot of people who don't think it was a big deal because in their mind, getting the vaccine shot was justified and they wanted it and they didn't experience a lot of things, and that's fine. I don't want to, let's just put that to bed because I don't want to get a lot of people riled up. There's a lot of people that they took the vaccine. It's not a big deal for them.
Correct. Yes.
That's fine. I'm super happy.
Yes.
But there's a lot of people who did have concerns, and right or wrong, they were in a position where there was, their livelihoods were threatened. They were outcasted from polite society, so to speak. There was a lot of stress and anxiety that went along with it. And that was huge. And on the back end of it, even though life has on the surface looked like it's continued on, a lot of people like yourself who might have, been adversely affected from the vaccine don't want to speak out. They want to say it because the continuation of those elements, they're still living. And it's a big deal with even what you're talking about earlier with people being dismissive about it, the interactions that you're receiving from the medical institution. I mean, Adrian Dix, if he really had any kind of real concern about anything, he would have at least sent a response.
Nothing.
And the unfortunate thing about this, which is a crying massive shame, is that everything is delivered with the intentions of the general public's good at mind. But it's at the expense of a sweeping negative impact to more people than people realize because everyone is worried and concerned about speaking out. And that's from doctors to individuals.
This isn't it's
deal.
not isolated. It's not isolated.
No.
So like to speak to that entirely, like there's a shame that's associated with any questioning. And how did we get that far? Like, how did we get that far that you just can't communicate, and that, we've got, families that are broken, and you very likely have, if we look at the attrition rates of like healthcare workers, there are some that have walked away because, there was a time that they believed that this was for the best, and then they realized, shoot, it's not, and so they've removed themselves, and for those that can't, they can't. And and it's not from just a medical perspective. Like there's families that don't communicate because we just can't have a different opinion anymore.
Yeah.
Like we're allowed to have different opinions. That's what makes us who we are. And like, don't you want, I want to learn from you. I want to hear what you have to say, and I want you to make me think for a second and be like, and then I want to go back and I want to look at it myself and be like, shit, I was wrong. Yeah, I should probably reconsider, maybe I was kind of like accurate, and I can build on that information more. It's
well, it's a sobering experience to think that what is happening real time in Canada is something that we typically only read or watch on the news that happen in other countries.
Yeah, because you think like, oh, we're so free.
Yeah.
We're so democratic here. Like this would never happen in Canada.
You know, and especially for St. John, that is a little bit disconnected because we feel like we're a little bit different than, you know, a lot of other places. And the reality of it is that this is something that reaches into every nook and cranny of it's not even just Canada. Yeah. This is a global thing. Well, at least North America.
Yeah.
But
well, and the other part too is like it's not over. Like it's not over. I don't think people realize that. Like I'm not a conspiracy theorist. I'll build my own tinfoil hat and wear it from time to time, and you know, be a Tin Man on Halloween, or you know. But like people go deep dive down this rabbit hole of like conspiracy theory. It's not. But like what we're going through right now, like it isn't over, and it's hard because we've been like herded, you know, like, cause you just couldn't see this happening in Canada. Like I love Canada. Like I love being Canadian, you know, I love living in Fort St. John. I love that we're like, you know, I love it. I love like our thought process, and I love like our community, and I love how we work together. And, you know, and I mean, there's pieces of this. And so my experience here with like the general population and medical professionals alike hasn't put me in a position where I have like heavy disdain for Canada or Fort St. John, because I don't, because people are entitled to their opinion. I might not like what you have to say, but don't be ignorant.
Yeah.
You know what I mean? Like someone said to me before, like, you know, if you have something to say, like, is it kind? Is it truthful? And is it necessary? You know, like I've been the first to admit that like I've owed apologies when, you know, what I said was kind and it was true, but like I didn't actually really need to say it, and it probably hurt the person's feelings more. So I should have shut my mouth, and I'll apologize, you know, but like it doesn't mean that we can't have differences of opinions. But if we're looking at our medical system, Kevin, like from a governance point of view and a regulatory point of view, like how British Columbia is shifting under Adrian Dix. Like I've witnessed the amalgamation of like our oral health colleges. I've witnessed Bill 36 coming to light, where me as a private practice owner who was regulated independently with a college specific for dental hygienists, and we regulated ourselves very, very, very well. You know, there's a very like robust disciplinary program and inquiry committee where we like very thoroughly reviewed claims against hygienists. And so, you know, there was discipline and there was cause and effect. And like, that's kind of like raising a child, right? Like bad.
Yeah.
But that's gone, you know, and like British Columbians don't even, half of them don't even know that Bill 36 exists. Like there's hygienists that don't even realize that we are not like
becoming more aware of Bill 36. And that's a pretty wild, holy cow is all I got to say about that.
Yeah. Yes.
That is, I think, a preset to something pretty intense coming down the pike when it comes to power grab. What's
the one that just went through, the Emergency Act?
Yeah.
The new one that just changed. And so Dan Davies, he's speaking to that. Like he was down in Victoria and he was talking about it and raising some like public concerns about the language. And that's the tricky part. We've been so distracted for the last 2 years, 3 years, that our gun laws in Canada changed. Bill 36 in British Columbia specifically changed. So private medical practices are not independently operated. There's an overseeing body that's government associated. Our regulatory and governance bodies like that used to have appointed members and elected members, and the elected members were actual healthcare professionals. So like dental hygienists sitting on a dental hygiene board. You know, we've moved that into now that only government people can serve on these boards. And I mean, I've been like living in a blur really for like a significant period of time, with moments of like pretty broad clarity. And I can't wait till like I'm like, you know, back on track and I can digest all this information, because a lot of what I've sent you, like I've gone through it, I've read it, I've applied it. There's things that I just can't quite grasp now, but I'll come back to it at another time. Yeah, this is just the beginning. It's just, this is like, just like set the tone for like what we're willing to accept and what we're willing to push against and what we're not. And this is not from a conspiracy perspective. It's happening. Like it's
Well,
happening.
when you start looking at a lot of different things and becoming aware of what's happening, Bill 36 is a prime example of that. I mean, there's a whole slew of other ones that seem to be alarming, you know. Freedom of speech, you know, it's Bill 18. I mean, it can go on and on.
The
I mean,
news, right? Like you can't, like none of Canadian news
news,
can be
free speech.
Yeah.
There's
Yeah.
a lot of things. 36 is probably for me one of that I know of one of the more alarming ones because it has control over absolutely everything underneath the medical.
Yes.
So freedom of movement, information, a lot of things that it has a power grab, takes all the different little avenues within our healthcare system, puts it under one umbrella that's controlled by the federal government.
Yes.
And that is
Well, the most
huge.
The most recent now is they're changing regulations on natural health products. So like it's looking like by 2025 for you to be able to go into the health food store and get a natural product, you're not going to be able to, or what's available, you won't be able to access. There's a company and I think they're in Lethbridge, Alberta, and they sell, I don't know if you eat organ meat, but organ meat's actually really good for you. There's a lot of nutrients. If we want to deep dive into like nutrition and you look at like introduction of like European diets and whatnot, and you know, eating organ meat and sugar and carbohydrates and all the things, organ meat's huge for like the right nutrients that we just don't get anymore. And so this company in particular in Alberta, they produce encapsulated liver. And so you're getting like the vitamin K2 that comes from liver. You're getting like all of these nutrients. And
can you send me the link for that?
For sure I can. It's called,
I'd love to put that in the show notes.
Yeah, it's called Naked something. They're not.
Cool.
They're not allowed to sell. Yeah, you're like gonna love it. They can't sell in Canada anymore.
Oh,
They can sell to the U.S. But as of like 2 days ago, they posted on Facebook that they are not allowed to sell their encapsulated liver in Canada.
there's a lot of things that are starting to choke hold, and I would like to say we should start wrapping it up here, but I do want to mention a few things here.
Yeah.
One, when it comes to your journey, I mean, first I'd like to touch on that because what you have gone through, I don't think we're able to touch on is in as much detail as we'd like to within the time limit that we're trying to do this in. And I think there's a lot there that is to be said about not only your tenacity, but the reasoning and behind what you're doing. I'm hoping that this is a milestone you're going to be able to get past so that you have a better idea of what the next step is going to be, because we're looking at, obviously the surgery is a focal point right now, but there's so much more past that. So feel free to come on, and I'd love to do a follow-up later on as things kind of progress.
Yeah, absolutely. Yeah, for sure.
And then when it comes to some of the documentation, I would like to just on the record kind of go over anything that I'm going to be sharing as a video overlap, or maybe links within the show notes are going to be with your approval. I want to make sure that we're not sharing anything or disclosing information that's going to get anybody into trouble. But there's some cool stuff there that I think would be good to be able to reference on the topics that we talked about. And then to kind of touch on the political end of things that we were explaining on the end, there's a divide right now. There's a conspiracy theory, air quote conspiracy theory, people who are trying to make changes in a positive way that are looked at as, whatever, radicals or whatever have you. And like I said earlier, I think our country, bar none, in my opinion, is the best in the world. And if it's not the best, I think it's
pretty darn close. Yeah. Pretty darn close.
And I don't think our government, as far as the system, is bad. I think it's probably the best system and has allowed us to get to where we are now. I think the problem is there's too many of the wrong people within the system. And I think the way out is to address a lot of the people who think that either burn it down and replace it is a better alternative. I don't believe in that. I think people need to get more engaged. And there is a reference here that I read, and I'm not sure who had this up, if anyone, but get involved, participate in democracy, and change the world by using your voice. And I think that's speaking to the fact that you need to get involved
Yeah.
It's a responsibility as a Canadian to get involved, and I'm no different than anyone else. I don't want to look like it's coming off as preachy,
Yeah.
but if you get involved in any kind of way and you look at it as a responsibility on whatever level your capacity is able to do, you're going to see the government change, which is a result of a lot of these multiple layers of issues that we're having right now start to slowly change. And I don't think it's going to be a quick little snap of the finger.
It's not
with an
it's-
election or whatever have you. I think it's going to take way more people to get uncomfortable with our standard of living, to get involved in what we have, which is the best thing in the world, is democracy.
Well, and I think like part of what I think has happened is we've become lazy, right? Like we took for granted this freedom that we had, that, you know, when you voted and it mattered and you were like so thankful that you had this opportunity to vote and your voice to be heard. And it's more critical than ever. And likely what perhaps has happened with the government leadership we have right now is that we probably ended up with too many people that thought the same, because the people that thought differently just thought my voice doesn't matter. Well, it does matter, you know, and like you have to believe it matters because it does. And the more people that will start, then there's more dialogue and there's more communication and there's different ideas and there's more philosophies and there's more challenge. And challenge isn't bad, right? Like the second that you start feeling like offended that you're challenged, you have a problem, you know, because like we should be able to like collectively work together. And I think that for so long, whether that's like laziness or our generation, or, you know, or like who's starting to vote now, or who stopped voting, or who believes voting doesn't matter, it does matter. And the other part too is like part of it's like exposure. Like we went to Eastern Canada last year. My brother lives there and I'm from Ontario. Well, my parents are from Newfoundland. I was born in Manitoba, grew up in Ontario, been here for almost 20 years. You know, just briefly coming back to like the truckers rally, like I talked to my girlfriends back east in Northern Ontario, and I was like, oh, like, are you guys going to go watch it? And they're just like bunch of idiots. And I was like, what? They're like, it's irresponsible. I was like, whoa, wow, we think so differently between Eastern and Western Canada. But then we went back and saw my brother, and we drove through like Quebec and Ontario, and it's like billboard after billboard after billboard of like, protect your family, get the vaccine, protect your family, get the vaccine. Like you drink the Kool-Aid, you're watching the TV. I don't have mainstream news. And my partner and I, Dave, left and came home, and I was like, holy crap. You easily could see there's only one opinion, right? Like the liberals are there. This is what's right. You know, you go to Quebec, and I don't know exactly fundamentally how they run their province, but like everyone's essentially equal. Like it's a socialism type of a style. Like it doesn't matter how much they're taxed the most, everyone, like it's just odd. And so you see that, and they're comfortable. We get comfortable. That's the problem. Comfort Crisis. I can't recall the author. Super awesome book. Amazing book. So Michael Easter. I might butcher that. Comfort Crisis. That's the book. And that's our problem. We've gotten so comfortable. We forget that we don't have to be at war to have change. You just have to be able to have like a difference of opinion and ask the questions and have a conversation like this, right? Like how far could we get if we could just sit politely at a table and not let your ego get the best of you, and entertain the idea that like, you know, people could have differences of opinions. And like, you're right. Like if you don't get engaged, even if it's like a municipal level or whatever level that is that you feel that speaks to you. And you know what, you might not have the right words. You might not have the right education. You might just have a heart to want to change that piece that's you're associated with, your circle of influence, right? Do it. Yeah,
it doesn't have to be much. Just attend a meeting.
It doesn't.
Maybe join PAC.
Yes.
Maybe whatever it is.
Yeah,
it doesn't matter what it is. It doesn't have to be huge. You don't have to go run for an MLA or an MP or be premier or be whatever. I mean, those are all good things, but it's just a matter of
me as sport.
Something. Sport. Exactly.
Me as sport, like introducing and being a part of organized sport for children.
Absolutely.
Like teaching them like discipline, focus, guidance from another adult, like listening to them, helping them develop, you developing, them teaching you. Like it's like a rudimentary skill set when you think about just sport, but when you think about what you learn and like people being able to like work together and build and grow. Like, you don't, it doesn't have to necessarily be
What's the alternative? What is the alternative? What is it to run and go where, or to say burn it down and then what? Because obviously you have no ability to get engaged in the system that's going on now.
Well,
so what exactly do you think the alternative is? Get involved. And I think neutral has to be brought back over into neutral instead of political parties chasing what they think neutral is based off of
what it's not, or what theirs isn't.
And get involved, and you'll see where neutral starts to come back to true neutral.
Like, it's not radical. You coin this like radical approach on a lot of things. It can become radical, but like the difference of disagreeableness isn't radical. You're just disagreeable because you have a different opinion, and that's okay. You know, get involved. Just get involved. And I mean, it took me almost 2 years to say something, and I was saying something. I was speaking, but I was afraid. And I was speaking like, you know, those that knew me well, and those that know me, and, you know, and then I was like, no, I'm not going to talk anymore. I'm going to put it out there.
I love it.
Yeah, me too.
Shining example. That's good. Well, I'm gonna wrap things up, and I'd like to end it on this last one. A ship in the harbor is safe, but that's not what ships are built for. And it was a pleasure. I'm glad you came on. I'm glad we were able to do this, and I hope to stay in touch.
Yeah, of course. I appreciate that. Thanks for the opportunity and the conversation and exchange of opinions. And I appreciate it, Kevin.
Awesome.
Cool.
Take care.
I will.
Wave to the camera. See you, everyone.
See ya.
Ciao.